of September. Say what? 20? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Go down to 3? Okay. Microphone check 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Some microphone check. This is much lower in the room. Check, check, check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Microphone check 1, 2, 3, 4, 5, 6, 7. Yep. What'd you say, Eric? Okay, give me a second. Okay. Did they? Did he express to them the time crunch we're under? Hello. Sorry, mind your seats.
No, it's all right. I'll go ahead and leave this here until we have some sound issues.
It's for the next hearing. Sorry.
Oh, got it.
Oh, don't worry. We're not covering this first one. So, the camera's on, but no one's gonna be operating it. We're about to lose this. He needs to express to them the time crunch that we're under. I can't hear. Okay. We're just trying to get our connection to C-SPAN. Good? Microphone check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is a microphone check from the witness table. Check, check, check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's from 1300 Longworth. This is probably not a good mic check because there's going to be more mics here for our hearing. Check, check, check. 1, 2. What? Yeah, witnesses need to sit down, so you guys need to wrap this up. Microphone check from the witness, from the chairman's seat. Check, check, check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is the chairman's microphone. Check, check. 1, 2. I see Haley's camera now, so you should be able to see me. Check, check, check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Microphone check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right.
The Ways and Means Committee will come to order. This morning, our committee will consider 5 bills that take action on several important priorities in health care and welfare policy, namely delivering targeted solutions to improve Medicare and supporting evidence-based programs to help Americans in poverty. I expect this markup to work through lunch. We will have votes on the House floor if we don't complete by then. And right now, my current thinking, if we need to, is to return tonight to finish the markup. We'll start today with our 3 health bills, all of which are bipartisan. First up is H.R. 3726, the Stark Administrative Simplification Act. This bill by Congressman Marchant and Kind builds upon legislation passed in July to modernize Medicare's physician self-referral laws. It sets up a process physicians can use to self-report and resolve technical violations of the Stark Law. And in doing so, the bill will allow healthcare providers to clear up inadvertent paperwork mistakes more quickly so they can get back to serving patients. Our second bill today is H.R. 3727, legislation by Budget Committee Chairman Black and Congressman Thompson that expands access to telehealth services for Medicare Advantage beneficiaries. This is one of several bipartisan bills we're working on to expand access to telehealth services throughout Medicare. This common sense legislation will improve patient outcomes, increase efficiency for healthcare providers, and reduce healthcare costs for beneficiaries and taxpayers. Our third health bill is H.R. 3729, the Comprehensive Operations, Sustainability, and Transport Act. This bill by Congressman Nunes and Congresswoman Sewell improves and extends add-on payments for Medicare's ground ambulance transport program. Importantly, the bill puts in place clear cost reporting requirements to make sure the program operates with efficiency and integrity for Medicare beneficiaries who rely on these crucial services. For the second part of today's markup, we have 2 bills from our Human Resources Subcommittee. We'll consider H.R. 2824, the Increasing Opportunity and Success for Children and Parents Through Evidence-Based Home Visiting Act. This bill, by Human Resources Subcommittee Chairman Adrian Smith, reauthorizes the Maternal, Infant, and Early Childhood Home Visiting Program. One of our committee's biggest priorities in welfare policy is making sure taxpayer dollars go toward programs that provide real results for families in need. In this case, home visiting for maternal, infant, and early childhood is a prime example. This bipartisan program has a demonstrated track record of positive outcomes, helping children and their parents in at-risk communities be more successful in school and at work and build better lives for themselves. Chairman Smith's legislation provides certainty for families, for states, and for communities by reauthorizing this program for 5 years. More than that, the bill reinforces our committee's dedication to advancing evidence-based policies that deliver real results for the American people using limited taxpayer dollars. Our final bill today is H.R. 2792, the Control Unlawful Fugitive Felons Act, co-sponsored by Congresswoman Noem and Chairman Sam Johnson. Serves to cover the cost of extending the home visiting program for 5 years. This program integrity bill prohibits supplemental security income, or called SSI, payments from being made to individuals with an outstanding arrest warrant for a felony or a parole violation. This isn't a new policy. In fact, it was first signed into law by President Clinton in 1996. And with Congresswoman Noem's bill, we're restoring the original intent of the law to make sure it's implemented as intended. The bill is simple. If you're wanted for a felony, for example, a crime such as rape, murder, burglary, or kidnapping, you'll not be able to receive SSI benefits until you make things right with the courts. The same is true for those with an outstanding arrest warrant for violating parole. It's about making sure Americans' tax dollars are not used to support those who evade criminal prosecution. It's common sense, and it's estimated to save American taxpayers, get this, $2 billion, again covering the cost of the home visitation extension. Closing, I want to thank all the members on both sides of the aisle who crafted the bill before us today. These are important priorities for the committee and for the American people. I hope all 5 of these bills receive the bipartisan support they deserve. This time I recognize the ranking member, Mr. Neal, for any opening comments he may have. Mr. Neal.
Thank you, Mr. Chairman. I'm pleased today that we are marking up 3 non-controversial health care bills, and I certainly want to commend our colleagues, Mr. Nunez, Ms. Sewell, Mr. Marchant, Mr. Kine, Ms. Black, and Mr. Thompson for their hard work on these issues. The Black-Thompson bill would bring telehealth services into the Medicare Advantage system. I certainly support this work, but I hope that we can get a commitment to also do more work regarding telehealth in fee-for-service Medicare. I know there are challenges, but telehealth is an issue that deserves further exploration. The Marchant-Kine bill provides additional technical modifications to the Stark self-referral laws, building on the bipartisan work we did in July on this issue. The legislation provides some common sense clarifications for providers while maintaining important Medicare protections. The Nunez-Sewell bill would provide a 5-year extension for Medicare ambulance provider payments. This longer-term extension gives an opportunity to begin to get cost data from ambulances to better inform future policy decisions. I expect that, like our markup in July, the extender-related provisions will find their way into the end-of-the-year health care extenders package. I want to take a moment to talk about extenders. I have great hope that we can continue our bipartisan work on this issue. Where I think we can get hung up and have in the past is finding offsets. My main concern is Medicare beneficiaries who tend to live on low fixed incomes, and also Medicaid and CHIP beneficiaries as well. In the past, Congress enacted some policies shifting more cost onto seniors, and I was not happy. I hope that going forward we can agree that we shouldn't be taking more money from our constituents. Also, I suspect that every member of this committee has a hospital in their district, at least one. And I'll also bet you're hearing from them about how they're feeling the squeeze and what that means for their bottom lines and ability to serve our communities, both for care and for good-paying jobs. Our hospitals are there for our communities when we need them. But following recent hurricanes, many hospitals were damaged in Florida, Puerto Rico, Texas, and the U.S. Virgin Islands. This time, our hospitals need us. I urge our Republican friends to protect the programs on which they rely rather than using them to pay for extenders. Now is not the time to play politics with our hospitals. Unfortunately, today's markup is not all bipartisan legislation. H.R. 2824 would reauthorize the Maternal, Infant, and Early Childhood Home Visiting Program, or MICV. It represents a missed opportunity to build on successful bipartisan achievements. And H.R. 2792, which I understand the majority plans to pair with H.R. 2824 before sending the bills to the floor, would take away the last lifeline for some of our poorest and most vulnerable seniors and people with severe disabilities. My Democratic colleagues and I strongly support reauthorizing MICV before authorization expires on September 30th. Any delay would slow hiring or suspend new enrollment of families, in turn undermining the important role the programs play in our communities. I'm certainly proud to be an original co-sponsor of H.R. 3525, the Home Visiting Works Act, which would reauthorize MICV and double its funding over 5 years. My hometown of Springfield, Massachusetts is a good example of how MICV has helped communities. Massachusetts found that 31% of the babies in Springfield were born to mothers with less than a high school education. In part because of the opioid crisis, infant mortality is nearly twice as high, and the rate of serious child neglect is 3 times the state average. Massachusetts used MICV dollars to fund a continuum of home visiting services in Springfield, which has benefited many families. Democrats in good conscience can't support MICV in this bill that would put home visiting services at risk in the communities that need them the most and paid for on the backs of our nation's most vulnerable populations. Our side will offer amendments to correct problems with H.R. 2824 and try to ensure that H.R. 2792 does not harm our constituents. I hope our colleagues will agree that these amendments are positive and we can move quickly to enact a clean reauthorization without harmful and dangerous cuts, and I yield back my time.
Thank you, Mr. Neal. Our first order of business, H.R. 3726, the Stark Administrative Simplification Act of 2017. I recognize the bill's sponsor, Mr. Marchant, for an opening statement.
Thank you, Mr. Chairman. Thanks for bringing this bill before the committee today. and I'd like to thank Mr. Kine for his help on this. The structured and simplified self-disclosure process in H.R. 3276 gives healthcare providers more certainty and predictability regarding the outcome of a very technical Stark law and its non-compliance disclosure. These modernizations will alleviate the backlog of burdensome disclosures and allow CMS to focus on the bad actors in our medical system. More importantly, hard-fought reforms to this process will allow the healthcare providers in our communities to get back to what they do best, treating and healing our constituents. Thanks again, Mr. Chairman, and I yield back.
Thank you, Mr. Marchant. I now turn to Mr. Kind for purposes of an opening statement.
Thank you, Mr. Chairman. I, too, want to thank Mr. Marchant for the leadership that he's shown on this issue. The Stark Law has been in place for some time now, and let's not use it as a gotcha mechanism to levy huge fines on what are, in essence, very technical, inadvertent, minor violations of the law. Just to give you a couple of examples, this would create an exception for self-reporting on a missing signature or a lease that may have expired over a year but was not changed in terms in any way. Documentation does not provide the technical writing requirements but still provides enough information so that all the parties know what's going on there. This allows self-reporting, which is what we want our entities to do, but without having to get slapped down and have to incur a huge unjustifiable fine. So we think it's a very common sense measure with some bipartisan support, and I'd encourage our colleagues to support the bill. I yield back.
Great. Thank you, Mr. Kind. We'll now proceed to consideration of H.R. 3726 without objection. The measure will be considered as read and open for amendment at any point. This time I offer an amendment in H substitute which was distributed in advance along with the green sheet explaining it. Without objection, amendment in the nature substitute shall be considered as read, open for amendment at any point, considered base text for purpose of amendment. I'll now turn to Emily Murray, the Staff Director for the Health Subcommittee, to provide the technical description of the amendment in nature of substitute with an emphasis on the changes made since introduction. I ask that members hold their questions until after her presentation. Ms. Murray?
Thank you, Mr. Chairman and Ranking Member Neal. H.R. 3726, the Bipartisan Stark Administrative Simplification Act of 2017, was introduced by Representatives Marchant and Kind on September 11, 2017. In general, the legislation sets up an alternative process for certain providers to self-report and resolve in a timely manner technical and inadvertent violations of Stark law. The legislation allows these providers to pay a civil monetary penalty depending on the violation and time frame in which that violation was reported in order to resolve it. H.R. 3726 sets up a process whereby the Secretary of Health and Human Services is required to make a determination on such a disclosure within 180 days. As noted on the green sheet, the Chairman's amendment would make a technical change. Mr. Chairman, that completes my walkthrough, and I'm happy to answer any questions.
Thank you. Are there any questions about the amendment of the nature substitute? Does anyone wish to strike the last word? Mr. Levin, you're recognized.
Thank you, Mr. Chairman. I think, like everybody else, I very much support this effort, this bipartisan effort, remembering the name of Pete Stark in it. But I think it's very troubling that we can find the time to act on this matter while completely ignoring our committee's responsibility to take action to strengthen the individual insurance markets that have been weakened by the President's actions and threats. As you know, Mr. Chairman, every one of us on this committee, all of us Democrats, sent you a letter last week urging you to hold bipartisan health care hearings as a first step towards action. Governors of both parties are working on solutions, and Republicans and Democrats in the Senate have begun to undertake such an effort. We should do that too, but so far the Republican leadership has failed and refused to do that. Millions of Americans who depend on the individual insurance market are waiting for Congress to act. The failure to work towards a bipartisan solution will make you responsible for the hardships endured by those whose coverage is threatened and whose costs may rise. Together, we can and should take some immediate steps to strengthen the individual insurance market. First, we must ensure ongoing funding for cost-sharing reductions, which help nearly 7 million Americans earning between 100 and 250% of the federal poverty level. The uncertainty about the continuation of these subsidies, which President Trump has fueled through his constant threats to terminate the assistance, negatively affects everyone in the individual market because insurers adjust rates to compensate for the potential loss of this funding. If anything, we should be expanding these cost-sharing subsidies. Second, we must support funding for crucial outreach and enrollment efforts. Unfortunately, the administration recently announced it has slashed 90% of federal support for advertising that encourages individuals to enroll in coverage. It has also instituted a new funding formula for navigator programs that will cut federal grants by more than 40% to community organizations. These cuts are likely to depress enrollment and could skew the risk pool in a way that raises premiums in the individual market. And third, we must provide support for risk mitigation programs that help stabilize premiums and encourage insurance participation in the markets. The ACA included 3 such programs, but 2 of them were allowed to expire and should be revisited. The Risk Corridor program helped insurers set accurate premiums by insulating them from extreme gains and losses. And the Federal Reinsurance Program provided payments to plans with higher cost enrollees, helping reduce premium increases due to an imbalanced risk pool. We should be considering reviving one or both of these programs. We should also consider other suggestions to strengthen the market as long as they're focused on sustaining comprehensive coverage and lowering costs for consumers. Mr. Chairman, I hope that you'll respond to our letter. And I hope you'll respond by having a hearing, meetings on a bipartisan basis in this committee as being done in the Senate. We've waited far too long to work on common sense bipartisan solutions to strengthen the individual health insurance market. And I don't know if you want me to do so. I think I have a little time. And if you would like to respond, I'd yield the balance of my time.
Sure. Has the letter been sent, Sandy?
Yes.
Great.
It was sent last week.
Great. Thank you. So let me take a look and review that, okay?
I think, Mr. Neal, we look forward to the response.
Maybe a bit more specificity.
So let me take a look at the letter in the subject matter, and let's have that discussion.
Good. Thank you.
Thank you. Does anyone else wish to strike the last word with specificity? Are there any amendments to the amendment in the nature of a substitute? If there are no amendments, questions on the adoption of the amendment in the nature of a substitute, all those in favor signify by saying aye. Aye. Those opposed, no. Being the chair, the ayes have it. The amendment in the nature of a substitute is agreed to. I'll now recognize Mr. Johnson for the purpose of offering a motion.
Mr. Chairman, I move the committee favorably report H.R. 3726 as amended to the House of Representatives.
Thank you. The question is on favorably reporting the bill H.R. 3726 as amended. All those in favor signify by saying aye.
Aye.
Those opposed, no. Being the chair, the ayes have it. The motion is agreed to, and H.R. 3726 as amended is ordered favorably reported to the House. Without objection, I ask the staff be authorized to make technical conforming changes to the bill. The members have 2 additional days to file with the committee clerk supplemental, additional, dissenting, or minority views. Our next order of business, H.R. 3727, to amend Title 18, Social Security Act, to include additional telehealth services for purposes of Medicare Advantage bids and for other purposes. I recognize the bill's sponsor, Chairman Black, for purposes of an opening statement.
Thank you, Mr. Chairman, and thank you for holding the markup today as we continue our work to improve access to quality, affordability health care to our nation's seniors. And I'm pleased to put forward the Increasing Telehealth Access in Medicare Act, which I believe every member of this committee can enthusiastically support. In my years as a nurse, especially as a long-term care nurse, I have seen firsthand how difficult it is for some seniors to access health care services. Particularly for seniors managing chronic conditions, their treatment regime can mean visits to this doctor and that doctor, and many times waiting for test results that go on and on and on for hours. Fortunately for patients, technology has advanced dramatically over the last several years, and our medical professionals now have the ability to harness these tools to deliver better health care. It wasn't very long ago that it was unthinkable to pick up a handheld device like my cell phone right here and make a video call. But today, my grandchildren and I can FaceTime with a push of a button. And these new technologies give us a chance to have telehealth capabilities that range from remote patient monitoring to two-way video consultation, around-the-clock nurse call-in telephone lines, email transmissions of test results and diagnostic imaging, and so much more. And using these services really can be a game changer for our senior citizens. Increasing convenience by reducing the number of in-person visits is very helpful. Improving care by ensuring continuous monitoring while a patient is at home. Giving them peace of mind by putting knowledgeable professionals just a phone call away. And equally as important is offering significant potential for cost savings to both the patients and Medicare program. So under current law, Medicare and Medicare Advantage plans have very limited ability to incorporate telehealth into their services. And my legislation starts to change that for Medicare Advantage programs, allowing plans to include telehealth in their base benefit. Where these plans currently must offer telehealth services as supplemental benefits, with either the insurer paying for them through rebates or charging additional premiums to our beneficiaries, this legislation gives Medicare Advantage plans the flexibility to incorporate these innovative new technologies into their core benefits. This bill is about upgrading current law to not just allow, but actually to encourage the use of telehealth technology to bring the best health care possible for our seniors, while also working to address those skyrocketing health care costs. Though this legislation is an important step in the right direction, our work on telehealth is not complete. I look forward to working with my colleagues to continue to expand telehealth to all Medicare. And I want to thank my Democrat colleague, Mr. Thompson, for partnering with me on this very important piece of legislation and his leadership on the telehealth policy here in Congress. And I also want to thank our colleagues, Representative Brooks and Matt Shuey on the Energy and Commerce Committee, who joined in producing this bill. This is a bipartisan bill. It's a common sense bill, and it's a solution that improves Medicare for our seniors, and I urge all of our members to support it. Thank you, and with that, I yield back.
Thank you. I now recognize Mr. Thompson for purposes of an opening statement.
Thank you, Mr. Chairman, and I'd like to thank Ms. Black for her great work on this very important bill. I've been working on telehealth issues since my time in the state legislature, and we were able to get some great things done in California, and I'm glad to see that Congress is following our lead and bringing telemedicine into more practice today, because as I've said before in this dais, telehealth saves money and it saves lives. And you don't have to look any further than this bill to see that. As Ms. Black pointed out, this gives Medicare Advantage plans the ability to deliver services to nearly 18 million enrollees via telehealth. And again, it'll save Medicare money, and it'll bring patients the care that they need. It'll give beneficiaries access to services such as virtual doctor visits, or allow utilizing remote patient monitoring to ensure beneficiaries are healthy as they remain in their homes. With this bill, plans will be able to give seniors access to their doctors via telehealth as a part of their basic benefit. This is going to be a great step forward for patients in all kinds of underserved areas, and I'm really glad that we're able to put this forward. So thank you, Governor, for your great work on this, and I yield back the balance of my time.
Thank you. The committee will now proceed to consideration of H.R. 3727. Without objection. Yeah, Mr. Thompson.
Before we do that, I would like to ask for an opportunity to enter into a colloquy.
Yes, sir.
With
Gentleman's
you, Mr. Chairman.
recognized.
Mr. Chairman, I again thank you, and I'm proud of this legislation we're considering today, but telehealth is a benefit that I believe should be available in Medicare Parts A and B as well. The parity between fee-for-service and Medicare Advantage is important as we work to strengthen Medicare and improve the delivery of benefits to Medicare beneficiaries. Mr. Chairman, can I get your commitment to work on expanding telehealth for all Medicare beneficiaries?
Yeah, Mr. Thompson, yes. I look forward to working with you and other members of the committee to expand telehealth services to all Medicare beneficiaries.
Thank you, Mr. Chairman. I yield back.
You bet. The committee will now proceed to consideration. Okay. The committee will now proceed to consideration of H.R. 3727. Without objection, the measure will be considered as read and open for amendment at any point. This time, I offer an amendment of nature substitute, which was distributed in advance along with the green sheet explaining it. Without objection, the amendment of nature substitute shall be considered as read, open to amendment at any point, considered base text for purpose of amendment. I'll now turn to Emily Murray, Staff Director for the Health Subcommittee, to provide the technical description of the amendment and the nature of a substitute, with an emphasis on the changes made since introduction. I ask the members hold their questions until after her presentation. Ms. Murray?
Thank you, Mr. Chairman and Ranking Member Neal. H.R. 3727, the Bipartisan Increasing Telehealth Access in Medicare Act, was introduced by Representatives Black and Thompson on September 11, 2017. The legislation would add a new benefit to the Medicare Advantage, or MA program, by allowing telehealth services to be included in the base versus supplemental benefit structure. H.R. 3727 would prohibit MA plans from including telehealth capital and infrastructure costs in their bids and ensure such plans cannot deny access to in-person services as a result of the new telehealth benefit. Furthermore, the legislation aims to move the traditional Medicare fee-for-service program towards further use of telehealth benefit in two ways. First, by clarifying that services provided under the existing chronic care management codes in the physician fee schedule can also be provided through telehealth services. Second, by including a sense of Congress that parity should exist between the two types of Medicare programs. As noted on the green sheet, the Chairman's amendment would ensure plan flexibility in offering telehealth services, add a section to deposit savings into the Medicare Improvement Fund, and make other technical and conforming changes. Mr. Chairman, that completes my walkthrough, and I'm happy to answer any questions.
Thank you. Are there any questions about the amendment in the nature of a substitute? Does anyone wish to strike the last word? Mr. Reichert, you're recognized.
Thank you, Mr. Chairman. First, I'd like to thank you and Ms. Black and Mr. Thompson for your hard work, and thank you for bringing this legislation forward today to improve seniors' access to telehealth care services. It's so important that we update our laws and embrace advances in technology. Telehealth services will expand access to health care throughout the country, particularly for those patients in rural communities. I'd like to just touch on another bipartisan issue that I've repeatedly raised before this committee. It's legislation that I've sponsored with Mr. Blumenauer in multiple Congresses to update and improve the Medicare program to support patients with lymphedema. Our bill, Lymphedema Treatment Act, has broad bipartisan bicameral support with 280 co-sponsors in the House, including 75% of the members on this committee. And today, there are nearly 2 million Medicare beneficiaries suffering from lymphedema who need our help. Medicare must be updated to cover the latest standard of treatment for these patient population. It is unthinkable and unacceptable that patients are forced to go without medically necessary compression garments to treat their condition. This is not about one disease. Closing this coverage gap will help patients suffering from over 40 primary rare diseases and many more secondary causes, oftentimes with lymphedema resulting from various cancers. And this is an issue that not only has bipartisan agreement in Congress, but provider groups and patients alike are pleading with us to get this done. the Oncology Nursing Society, American Occupational Therapy Association, and the Lymphedema Advocacy Group submitted comments to the committee seeking a correction to the lymphedema coverage gap as a part of the red tape initiative. And provider organizations like the American Medical Association and American Physical Therapy Association, among others, in addition to clinicians from the Mayo Clinic, MD Anderson, and James at Ohio State University, have endorsed the bill and called on Congress to fix this coverage issue for members and the patients they serve. Mr. Chairman, as we pass legislation today to update Medicare and expand access to needed benefits like telehealth services, I look forward to working with you and other members of this committee to build upon these efforts in the coming months and take up and pass legislation to fix the lymphedema coverage gap before the end of the year. I thank you, Mr. Chairman. I yield back.
Mr. Riker, thank you for your leadership on that critical issue. Dr. Davis, you're recognized.
Thank you very much, Mr. Chairman. I speak in strong support of this legislation and simply want to commend Representative Black and Thompson for their work. I've long been an advocate of telemedicine, telehealth, especially as it relates to health education, health awareness, health promotion, and as our senior populations are increasing daily, this becomes even more important. I think it is especially helpful for those individuals who live in medically underserved and isolated areas. Again, I commend my colleagues for their leadership, strongly support it, and yield back the balance of my time.
Thank you, Dr. Davis. Ms. Sewell, you're recognized. Strike the last word.
Thank you, Mr. Chairman. Representative Black and Thompson should be commended for their bipartisan work on this bill. Every district in the country has much to gain from expanding the use of telehealth. I am told by providers and device manufacturers often that they are ready to expand the use of telehealth. They are waiting on Medicare and Medicaid payment policies and our telecommunication policies to make it feasible to expand those services. My district is home to the University of Alabama at Birmingham, where some of the finest specialists and researchers and medical professionals practice. But as we travel south in my district into the rural communities, the medical landscape is much different. I have many constituents who live a couple of hours south of Birmingham who do not have access to the specialists in Birmingham. As I've said on this committee before, attracting medical professionals to rural and underserved areas is one of the greatest challenges we face. There are virtually no specialists in the 11 of the 14 counties in my district, and the consequences have been severe. For those who travel to Birmingham or Montgomery, Alabama to see specialists, they miss work and spend a great deal of their resources on travel time. Then there are those who simply can't make the trip, so they don't. Geography and social economic comparative health data shows that those who can't make the trip have poorer health outcomes and, even worse, higher mortality rates. I talk to young medical students and professionals who study at UAB often. Many of them have to practice in these communities, but they know that they would be better off staying in Birmingham instead of going to these smaller communities. So I really want to thank Representative Black and Thompson for their work today for addressing this issue. I think it's another way of getting better services for rural and underserved communities. While young physicians and providers face a greater amount of disincentives to practice in rural and underserved communities, our most vulnerable constituents are the ones who stand to gain most from expanding the use of telehealth. Travel time could be cut significantly for critically ill seniors and Medicare Advantage patients under this bill. Instead of traveling 2 to 3 hours or more to see a specialist, they can travel to their community doctor or hospital to be connected to a specialist hours away. These reduced travel times would result in fewer missed appointments and better patient outcomes. In addition, there are Americans who have never been to a specialist due to access issues. This bill will potentially connect countless older Americans with specialists for the first time in their lives. And rural hospitals and providers would be able to increase volume and revenue by partnering with specialists in bigger cities. Mr. Chairman, the bottom line is that long-term benefits of telehealth will be greatly improved by this bill we're marking up today. And so on behalf of countless Alabamians who stand to benefit, I look forward to the passage of this bill and the advancement of other telehealth payment policies. I yield back the balance of my time.
Thank you. Does anyone wish to strike the last word? Mr. Lewis, you're recognized.
Mr. Chairman, I want to thank my colleagues and friends on this committee, Congresswoman Black and Congressman Thompson. Telehealth means everything to a state like Georgia. Georgia is a very large state. We have 159 counties. A lot of our medical services are concentrated in my district in the city of Atlanta, in the suburbs. With telehealth, we are reaching hundreds and thousands of people. And I strongly support this effort. I yield back.
Thank you, Mr. Lewis. Does anyone else wish to strike the last word? Are there any amendments to the amendment in nature substitute? If there are no amendments, questions on the adoption of amendment in nature substitute, all those in favor signify by saying aye. Those opposed, no. In the chair, the ayes have it. The amendment in nature substitute is agreed to. I'll now recognize Mr. Johnson for the purpose of offering a motion.
Mr. Chairman, I move the committee favorably report H.R. 3727 as amended to the House of Representatives.
The question is on favorably reporting the bill, H.R. 3727, as amended. All those in favor signify by saying aye.
Aye.
Those opposed, no. Opinion of the chair, the ayes have it. The motion is agreed to, and H.R. 3727, as amended, is ordered favorably reported to the House. Without objection, I ask staff be authorized to make technical conforming changes to the bill. The members have 2 additional days to file with the committee clerk supplemental, additional, dissenting, or minority views. Our next order of business, H.R. 3729, Comprehensive Operations, Sustainability, and Transport Act of 2017. I'll recognize the bill sponsor, Mr. Nunez, for purposes of an opening statement.
Thank you, Mr. Chairman. I want to start by thanking you, Chairman, and Ranking Member Levin for scheduling this markup and bringing up my bill. Actually, I meant not Ranking Member Levin, but Neil. Bringing up my bill, H.R. 3729, the Comprehensive Operations, Sustainability, and Transport Act. This bill will extend the add-on payments currently in place for ground ambulance transport for Medicare beneficiaries for 5 years. The legislation will require ambulance suppliers to submit cost reporting data for the first time in order to help understand the real costs of the industry and better align Medicare ambulance payments with the true cost of providing services. It will also require CMS to work with stakeholders in developing these ambulance cost reports to ensure they are workable and are established by those who have real-world experience in this field. I've worked very closely with the ambulance industry in my district in order to ensure the policy enacted from this legislation will provide the resources necessary in order to deliver life-saving care not only on my constituents, but to all citizens across the country. This add-on extension will benefit suppliers that provide health care in all areas, including those classified as urban, rural, and super rural, so that broad access to emergency care is guaranteed. We are looking forward to working with CMS to ensure this legislation is completed for the benefit of the entire industry. Our first responders, including the ambulance industry, have shown us time and time again that they will fearlessly provide service during the worst of times. When the recent anniversary of 9/11, as well as particularly treacherous hurricane and wildfire season, we are reminded how important our first responders are and the significance of the services that they provide. Mr. Chairman, I look forward to working with you in order to get this bill across the finish line and ensure the survival and capability of this vital industry. Securing the extension of the ambulance Medicare payment add-ons for an additional 5 years will do just that. Again, Mr. Chairman and Ranking Member Neal, I appreciate the support and look forward to working with you further on this legislation.
Terrific. Thanks, Mr. Nunez. Now recognize Ms. Sewell for purposes of an opening statement.
Thank you, Mr. Chairman. I'd like to thank both you and Ranking Member Neal for bringing our rural ambulance bill before the committee today, and I'm very proud to have worked on this committee with our California colleague, Mr. Nunez. In towns and counties where hospitals and sufficient health care providers do not exist, ambulance services are often the only provider of emergency medical services. In the most severe cases, an EMA or paramedic can be the only medical professional in a community. I've learned that for too many of my constituents, their first and most common exposure to the healthcare industry is in an ambulance. As we continue to work towards meaningful long-term reform, we must provide certainty to the ambulance industry and other healthcare industries with extenders. Expiration of these payments would further erode the rural healthcare safety net. Adequate ambulance services are a matter of life and death for so many Americans, regardless of geography. For rural Americans, the distance between them and the closest hospital can be far, often an hour or more. In an emergency, reliable ambulance services can be the only hope that these folks have for survival. I received a message from my constituents in a county without ambulance service recently. The week prior, her sister-in-law had waited 2 hours for an ambulance. She died during transportation to the hospital in Tuscaloosa, Alabama. In her letter, my constituent writes, "I am not speaking about a privilege to the people in this area, but for a right to emergency services, which has turned out to be a matter of life and death for my family." Mr. Chairman, the timing of today's markup is particularly personal to me and my constituents. We are working right now to save several hospitals in rural parts of my district. One of the hospitals is close to being closed, but due to the help of local resources is staying open, but the hospital operates week to week. My constituents in rural parts of my district deserve their hospitals and local healthcare providers to be close to them and to have services, emergency services such as ambulance services. No person in this country should have to fear what would happen in an emergency if an ambulance cannot reach them. A few weeks ago, I was meeting with a large employer in my county, in one of the counties in my district, and the first question that the business owner asked about the closure of that hospital was how long would it take for an ambulance to reach the plant and get back to the nearest hospital? The answer was over an hour. The reality is, Mr. Chairman, we cannot attract and maintain industries in counties where healthcare providers don't exist or are inadequate. When hospitals falter, the quality of the ambulance and EMT services that keep it's the quality of the ambulance and EMT services that keep industries from packing up and leaving. Ambulance providers cannot continue to provide services in under-resourced counties if they do not have more certainty to their payments. I've been asked if working to save access to rural health care is worth it, as if a hospital is as necessary as a Starbucks. Some say that the impact of rural hospital closures affect enough people for us to be concerned with, and that ambulance providers can fill the void by transporting patients to urban areas for care. I often tell folks that unless we drastically change our reimbursement for Medicare and Medicaid services, ambulances will not be able to continue providing services in rural and underserved counties if we lose rural hospitals and rural providers. I would be remiss by not highlighting that our colleagues, Representative Delbene and Walorski, have been working on the add-on payment for air ambulance providers. These providers are very important to rural America as well, and I want to thank them for their continued work on this. I'm disappointed that we were unable to get the air ambulance providers included in today's bill, but we must continue to address air ambulance providers along with other extenders that matter in districts across America, especially those with rural communities. We must focus on meaningful service delivery reform in our country, and I believe that today's bill will go a long way. To be clear, it is difficult for ambulance industry to deliver savings when so many Americans remain uninsured or underinsured, with ambulance and emergency rooms being their primary point of care. Mr. Chairman, I fully urge all of my colleagues to support H.R. 3729, Comprehensive Operations, Sustainability, and Transport Act of 2017, and I look forward to it coming to the floor and passing. I yield back the balance of my time.
Thank you. The committee will now proceed to consideration of H.R. 3729. The objection measure will be considered as read and open for amendment at any point. This time I offer an amendment in nature substitute which was distributed in advance along with the green sheet explaining it. Without objection, the amendment in the nature of a substitute shall be considered as read, open for amendment at any point, and considered a base text for purpose of amendment. I'll now turn to Emily Murray, Staff Director for the Health Subcommittee, to provide the technical description of the amendment in nature substitute with an emphasis on the changes made since introduction. I ask that members hold their questions until after her presentation. Ms. Murray, you're recognized.
Thank you, Mr. Chairman and Ranking Member Neal. H.R. 3729, the Bipartisan Comprehensive Operations, Sustainability, and Transport Act, was introduced by Representative Nunes and Sewell on September 11, 2017. In general, the legislation aims to more accurately reimburse and sustain access to ground ambulance transports in the Medicare program. Beginning in 2020, the legislation would require submission of annual cost report data by ambulance suppliers to the Centers for Medicare and Medicaid Services in order to better understand the cost of furnishing ground ambulance services. H.R. 3729 creates an enforcement mechanism to ensure that data submitted is first timely and then accurate and complete. The legislation allows for stakeholder input, ensures flexibility, and aims to reduce burdens through allowing the Secretary to modify cost reporting requirements for low-volume suppliers, establishing a hardship delay for those who need additional support or an extension, and including resources for moving towards the new system. Furthermore, H.R. 3729 extends for 5 years the current add-on payment for rural, super rural, and urban ambulance transports set to expire on December 31st, 2017. The cost of this legislation is offset by increasing a current law payment reduction for non-emergency dialysis transports. As noted on the green sheet, the Chairman's amendment would, in addition to technical changes, add a requirement for the MedPAC ground ambulance cost report study required under the legislation. Specifically, MedPAC would be required to also look at the extent to which state mandates may create geographic variations in the cost of providing such services. Mr. Chairman, that completes my walkthrough, and I'm happy to answer any questions.
Thank you. Are there any questions about the amendment, nature of a substitute? Does anyone wish to strike the last word? Mr. Nunes, you're recognized.
Mr. Chairman, I'd like to have a colloquy.
Yes, sir.
Mr. Chairman, will you work with me in the Congressional Budget Office in order to iron out technical edits to the pay-fors in this legislation?
Yes.
Well, thank you.
Well, that's that specificity we're looking for.
Also, Mr. Chairman, there is some remaining concern surrounding the mechanisms used to enforce annual cost reporting, and I'm hoping that you'll help all of us and the stakeholders come to consensus regarding the enforcement mechanisms for cost reporting, and specifically for the mechanisms surrounding CMS issuing a payment suspension versus overpayment recoupment.
Yeah, Mr. Nunes, I look forward to working with you and the ambulance stakeholders to come to consensus on the pay-for. Thank you.
I appreciate that, Mr. Chairman, and also I would like to, forgot to thank Ms. Sewell for her support as my lead co-sponsor on the other side of the aisle, so I'd like to thank her for her support.
Great, thank you. Thank you, Mr. Nunes. Ms. Walorski, you're recognized.
Thank you, Mr. Chairman. I appreciate your hard work, and Representative Nunes as well, on H.R. 3729. I'd like to highlight the need to update the air ambulance provisions within Medicare. Ambulance providers are one of the few providers that do not currently report cost data to CMS, which has led to underpayments for air ambulance services. I fear if we don't fix the air ambulance side of the program, we'll start to see negative effects, especially in rural areas that I represent. I know my colleague and co-lead of H.R. 3729, the Ensuring Access to Air Ambulance Service Act, Congresswoman Delbene, shares the same sentiments. Mr. Chairman, would you be willing to work with Congresswoman Delbene, myself, and on our legislation, H.R. 3378, which would reimburse air providers based on cost data reported to CMS?
Yes, ma'am, and I know both of you and Ms. Delbene have put considerable work into this. We'd like to continue to work with you to get to a resolution.
Thank you, Mr. Chairman.
Ms. Delbene, you're recognized. Strike the last word.
Thank you, Mr. Chairman. I just want to thank Congresswoman Walorski for her comments and for her hard work on legislation to support air ambulance services. We have to ensure that no American faces a barrier to critical care in an emergency. And unfortunately, the Medicare reimbursement system for air medical services has not been updated in 20 years, and that jeopardizes people's access to treatment, particularly in rural and underserved communities. So it's critically important that we work on this. So again, want to thank Ms. Walorski, and thank you, Mr. Chairman, for working with us on this important issue. I yield back.
No, thank you very much. Does anyone else wish to strike the last word? Dr. Davis, you're recognized.
Thank you, Mr. Chairman. I speak in strong support of this legislation and commend Representative Nunes and Sewell for developing it. Especially was I moved as I listened to the testimony and the discussion led by Ms. Sewell. There isn't much rule in the district that I represent, but I lived for 19 years in a rural community. And the people in my family often suggest that my mother may have died prematurely because she had to travel more than 100 miles in order to receive dialysis treatment. So I think that this is a well-done piece of legislation. Especially does it speak to the needs of rural America, rural citizens. I strongly support it and yield back the balance of my time.
Thank you, Dr. Davis. Anyone else wish to strike the last word? Are there any amendments to the amendment in nature of substitute? There being no further any amendments, questions on the adoption amendment in nature of substitute. All those in favor signify by saying aye. Aye. Those opposed, no. Being the chair, the ayes have it. The amendment in nature of substitute is agreed to. I'll now recognize Mr. Johnson for the purposes of offering a motion.
Mr. Chairman, I move that the committee favorably report H.R. 3729 as amended to the House of Representatives.
Thank you. The question is on favorably reporting the bill. H.R. 3729 as amended. All those in favor signify by saying aye. Aye. Those opposed, no. Being the chair, the ayes have it. The motion is agreed to, and H.R. 3729 as amended is ordered favorably reported to the House. Without objection, I ask the staff be authorized to make technical and conforming changes to the bill. The members have 2 additional days to file with the committee clerk supplemental, additional, dissenting, or minority views. Our next order of business is H.R. 2824, the Increasing Opportunity Through Evidence-Based Home Visiting Act. I recognize the bill's sponsor, Mr. Smith of Nebraska, for purposes of an opening statement.
Thank you, Mr. Chairman. Today we are here to mark up the Increasing Opportunity and Success for Children and Parents Through Evidence-Based Home Visiting Act to reauthorize the Maternal, Infant, and Early Childhood Home Visiting Program known as MCV. This program helps support state and local efforts to provide voluntary, evidence-based, outcome-focused home visiting services to parents and children living in communities that put them at risk of poor social and health outcomes. The program's objectives include promoting school readiness for young children, increasing economic self-sufficiency of families, improving prenatal health and birth outcomes, and preventing child abuse and neglect. I, like other members of this subcommittee and committee, have had the opportunity to see firsthand what home visiting looks like in our communities. In March, I spent time with the Panhandle Public Health District's Healthy Families America program, which aims to improve the economic success and school readiness of vulnerable children and families in 3 Nebraska counties, Scottsbluff, Morrill, and Box Butte counties. Dawn, one participant I met with, shared her experience of working with a home visitor who helped her find a stable home and a steady income in order to provide for her growing family. These are the types of outcomes we should be expecting and receiving from the use of limited taxpayer resources. MCV is one of the only social programs where funding is tied to proven evidence. Unfortunately, MCV is an exception to how we often fund programs, as few federal social programs have been evaluated to determine if they are working, and almost none tie the receipt of funding to evidence of effectiveness. In the Better Way agenda put forward by House Republicans last year, we proposed doing more of what MCV does: measure how well programs are working to focus funding on programs which produce real results. When we spend limited taxpayer dollars to help those in need, we must make sure we're spending money on effective programs. To do otherwise is a disservice to both taxpayers as well as those who are seeking to help. On March 15th of this year, the Human Resources Subcommittee held a hearing on MCV. 2 of our witnesses, Beth Russell and Rosa Valentine, shared their experiences working together through the Nurse Family Partnership Program in Lancaster, Pennsylvania, a home visiting program supported by the program. Rosa was 14 years old when she found out she was pregnant and was unsure how she would be able to take care of her baby while also achieving her education goals. Her nurse, Beth, helped her have a healthy pregnancy, cope with stress, and become a confident mother. By using the evidence-based nurse-family partnership model, Beth successfully helped Rosa through her pregnancy and continues to guide her through her first 2 years of motherhood. Today, Rosa is a 16-year-old junior in high school, is on track to graduate next year, and is a loving mother to a healthy 20-month-old daughter. Both before and after the hearing, we sought input from states and others about how the program was working and how it could be improved and strengthened. The result of these conversations is the bill before us today, which would, number one, continue the program at the current law level of $400 million per year for 5 years. Number two, make sure states continue to achieve results. 3, require states to periodically reassess needs across the state to focus on high-risk communities. Number 4, allow states to fund home visiting services on a pay-for-outcome basis. And finally, strengthen partnerships between the federal government and state, local, and private organizations by requiring a dollar-for-dollar match by FY 2022, mobilizing more resources to serve families in need. There is broad bipartisan support for McVie, including dozens of national organizations and hundreds of state and local organizations, ranging from business leaders, law enforcement officers, faith-based groups, healthcare providers, child welfare advocacy organizations, and early education providers. While I understand some of my colleagues would like to continue this program or even increase spending on the program without paying for it, our current deficit means it would be irresponsible to continue to fund programs without finding ways to reasonably reduce spending elsewhere. I'm grateful for the time we are spending today to mark up this important bill, and I look forward to moving forward so we can ensure this program continues in the years ahead. Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Smith. I now recognize Dr. Davis for the purpose of an opening statement.
Thank you very much, Mr. Chairman. Following the wisdom of Frederick Douglass, who said that it is easier to build strong children than to repair broken men, I introduced my first bipartisan home visiting bill over a decade ago in 2005. Since 2005, home visiting has been uniquely bipartisan until today. H.R. 2824 presents substantial cuts to home visiting and threatens the effectiveness of services for vulnerable children and families. Equally bad, the Republican reauthorization bill conditions home visiting help to vulnerable families on harming vulnerable seniors and persons with disabilities. Although that harmful provision has been temporarily removed from the bill we're considering today, I understand that the majority plans to restore it before taking further action. I join with over 110 civil rights, disability, and aging advocates to strongly oppose the Republican effort to pay for home visiting services that strengthen vulnerable children by stripping certain low-income seniors and those with severe disabilities of basic income they need to survive. 826 organizations urged House and Senate leaders to reauthorize this important program for 5 years with a doubling of funding from $400 million annually to $800 million annually to allow states, territories, and tribes to expand these services to more children and families. Yet, H.R. 2824 fails to increase funding by even 1 penny. Current MCV dollars serve only about 6% of eligible families and less than 50% of eligible tribes. Yet, the Republican bill fails to give them 1 cent more. And even worse, it enacts changes that dramatically cut critical home visiting services and undermine its success. Just as with their failed health care bill, this Republican bill pushes their fight to make states pay more for services while harming vulnerable children and families as collateral damage. There is no doubt that the state match in this bill will reduce home visiting in many states and tribes, cut services, and harm families. The Republican bill will further undermine successful home visiting by changing it from a program to improve child development and parent-child relationships to a failed jobs program. Defining a core outcome of MCV as increased employment and earnings will gut federal home visiting. Not one of the evidence-based models is a job training program. Not one. This bill says that if any program wants to improve economic self-sufficiency, it shall include employment and earnings. Further, the bill applies stringent, unrealistic outcome standards. H.R. 2824 is failure by design for home visiting. After a decade of bipartisan efforts to increase federal funds for home visiting, I am deeply saddened that H.R. 24 now is the House Republican priority list for cutting funding, reducing services, and undermining the infrastructure so many have built. I unequivocally oppose this harmful bill and its discriminatory pay for. I join the good company of the NAACP, the American Academy of Pediatrics, Justice in Aging, National Women's Law Center, and the ARC of the United States, just to name a few. I yield back.
Thank you. The committee will now proceed to consideration of H.R. 2824. The objection measure will be considered as read and open for amendment at any point. This time, I offer an amendment in the nature of a substitute, which will be distributed in advance along with the green sheet explaining it. Without objection, the amendment in the nature of a substitute shall be considered as read, open for amendment at any point, and considered base text for purpose of an amendment. I'll now turn to Ann DeCicero, Staff Director for the Human Resources Subcommittee, to provide the technical description of the amendment in the nature of a substitute, with an emphasis on the changes made since introduction. I ask that members hold their questions until after her presentation. Ms. DeCicero.
Thank you, Chairman Brady and Ranking Member Neal. H.R. 2824, the Increasing Opportunity Through Evidence-Based Home Visiting Act, reauthorizes the Maternal, Infant, and Early Childhood Home Visiting Program, or MCV, for an additional 5 years. MCV is an evidence-based program that helps to improve the lives of families in at-risk communities, focusing on the first years of a child's life. Unlike most federal social programs, MCV funding is tied to producing real results for the families it serves. As reflected in the green sheet distributed yesterday, the Chairman's amendment in the nature of a substitute modifies H.R. 2824 as introduced by clarifying under Section 2 to now read increasing opportunity and success for children and parents through Evidence-Based Home Visiting Act. Beginning on page 6, line 12, striking section 105, building evidence to increase program effectiveness. Beginning on page 11, line 18, inserting a delayed match percentage scheduled for tribal organizations and a clarification on the types of funds that may be used to meet the match percentage. And beginning on page 16, striking Title II of the bill, which will be considered separately later today. In addition, there are a number of technical changes designed to improve the clarity of provisions throughout the bill. Mr. Chairman, that completes my walkthrough, and I'm happy to answer any questions.
Thank you. Are there any questions about the amendment in the nature of a substitute? Does anyone wish to strike the last word? Mr. Bishop, you're recognized.
Thank you, Mr. Chairman, and thank you for holding today's markup on several important bills. In particular, I'd like to raise my voice of support for H.R. 2824, which would reauthorize the Maternal, Infant, and Early Childhood Home Visiting MCV program. As we heard, MCV is an evidence-based program that helps improve the lives of families in at-risk communities, focusing on the initial years of a child's life. I have seen firsthand its successes. I recently traveled to a nurse family partnership, an NFP facility, which is a nonprofit that arranges home visits from registered nurses to low-income first-time mothers, and met nurses and women currently enrolled in the program. The NFP facilities help transform the lives of vulnerable first-time moms and their babies, empowering them to build brighter futures and stronger families, none of which would be possible without MCV funding. Moreover, I am proud to note that Michigan is investing significant amounts of funding toward NFP facilities and other organizations in addition to the MCV funds, meaning they would meet the match requirements proposed in this bill already. I'm particularly thankful for the Chairman's transparent engagement process. For instance, I raised concerns that the addition of a new evidence standard, along with the substantial evidence standards already in place, would be problematic, and I wanted to ensure that the home visitors we're not overly burdened with collecting data so that they can care for the mothers and their babies. Both of these concerns were addressed with the amendments contained in the Chairman's amendment, and I thank Chairman Smith and Chairman Brady for doing so. Mr. Chairman, I join my colleagues in urging support of 2824, and I yield back.
Mr. Bishop, thank you for your work in this area. Mr. Thompson, you're recognized to strike the last word.
Thank you, Mr. Chairman. I too, as other members have stated, have great success with this program throughout my district. I too have a nurse family partnership program in the Solano part of my district that's is fantastic. It's hailed by everyone as a success, and the outcome speaks for itself. I have a couple of tribal programs that have done tremendous work in providing structure and help in young lives. And as I said, it's universally hailed by everyone, the state, the counties, the tribes, all of the outside groups that advocate for such services. And no one has asked me to work on any of the changes that are in Mr. Smith's bill. So, Mr. Smith, I agree with you in your opening statement, at least about 50% of it. The idea of going back and making these changes, the folks who are on the ground working on these programs tell me that this is going to hurt their program. It's not going to help them. So I don't know who you're talking to get the idea that these changes need to be made, but everyone that is operating these programs in my district tells me just the opposite. As a matter of fact, some of the areas where they're working best are in areas in low-income areas. They don't have the resources to meet the requirements of these proposed changes. So I think we would be ill-advised trying to break course and break course with the experts who run these programs and the communities that are served by these programs. I don't think that this bill empowers communities to raise healthy children. I think it would undermine a great bipartisan program without any reason, and for this reason, I will oppose the bill.
Mr. Schweiker, you're recognized to strike the last word.
Thank you, Mr. Chairman. Look, I can actually only walk through a couple of experiences we've had in Arizona. Just a point of reference, and I think my number is still correct, 56% of the babies born in Arizona are actually born on our Medicaid system. We call it Access in Arizona. But because of the flexibility that's in the program, that also the update in the legislation brought to us by Mr. Smith can continue, in Arizona we're doing things like we're experimenting with telehealth visits to this population, which actually is turning out to have some great data and actually be very, very efficient. And please understand, in a state like Arizona, I believe we receive about 11 million, but the state matches with an additional 18 million. So we're fine. And actually, as we all know, for those of us who've been in state legislatures before, if you don't have some skin in the game, you don't pay attention to the details. And legislatures often jealously guard something where they have to appropriate some dollars to it. So in many ways, I believe this will bring more creativity, more discipline to the program. Also, just a little aside, just because it was something in my notes, having done, there's a couple of us here on the committee that have spent a lot of time on tribal policy. And my tribes often are, the request is to be treated similar to a state, not to be given something that is just a carte blanche, but treat them with some equivalency. And I believe that's actually the direction we're going. And with that, Mr. Chairman, I yield back.
Would the gentleman yield?
Let me, can I take back my yield back?
Thank you. I do want to note that we've been working on this bill for months, gathering input from stakeholders. And, you know, from time to time, there may not be unanimous support for some changes, but there has been consensus for modest changes. But by and large, we are moving the program as it's been, moving it forward. Yes, there is the match. There's another pay for ultimately. But fact of the matter is, this work product is a result of months of input from stakeholders. And I think it's important that we not let down the stakeholders by rather arbitrary opposition. Thank you. I'll yield back.
Thank you, Mr. Smith. Reclaiming my time, the last thing I'll throw in there, just because it was fading in memory, one of the optimisms I get from my folks in Arizona is there's enough flexibility in this program to try new things. And for many of us, we just all said really nice things about a telemedicine bill. Should a poor person have access to health information, family support through this thing? And that's what we're experimenting with in Arizona. We'd like to continue. Who knows what the next generation of creativity and ability to reach out. And with that, I yield back, Mr. Chairman.
Thank you, Mr. Swiker. Mr. Doggy, you're recognized. Strike the last word.
Thank you so much, Mr. Chairman. I want to associate myself completely with the comments of Dr. Davis and of Mr. Thompson concerning the great wrong that is being done here today. The home visiting program, to me, is a little bit of a misnomer. This is not about dropping by for a friendly visit, just to be talking. It is about skilled professionals who work to strengthen families. It is about family values and about helping parents, particularly young, disadvantaged parents, be the parents that they want to be if they can have some tools and to help to get there and overcome whatever crisis their family may be facing at the time. The type of situation that our family visiting programs, including successful ones that I have seen in San Antonio, in San Marcos, and Austin, and have heard about from across the country. A young family that wasn't expecting to have a child and is struggling economically. A family that finds themselves with a child very different from the one they had hoped for, who has some severe disability. A family that has a child that cries all night long, and who some may decide the solution is to slap or shake the child, or to place the child in front of a TV set all the time to avoid crying. Those are the kind of practical problems that these skilled professionals reach in and help that family find solutions to the challenges that they have. And these programs have been so effective that during the time that I served as the ranking Democrat on the Human Resources Committee, I heard each of 3 different Republican chairs praise the program. After all, the pilot program began under President Bush, and it has enjoyed good, solid, bipartisan support when it comes to talking. It just hasn't enjoyed any bipartisan support, and it does not today when it comes to paying the price to have effective programs. I raised this issue on the first meeting of this committee again this year in hopes that we could achieve bipartisan support for a program that is precisely, as Chairman Smith advanced in his opening remarks, a program that is evidence-based. And for him to say that this shows the Better Way agenda, they want to do more of this. Well, they don't do more of it with the program that worked, that they have praised, that their witnesses have come forward, not just for the last few months, but for the last many years, Republican and Democratic witnesses alike, and said, this is a program that works, and we're willing to have it tested. It is an evidence-based program. I agree fully with Mr. Bishop and the comments that he just made, that without this program being in place, many of these young families in his state and elsewhere would not receive any help at all. And so this great program that all of us have agreed on, that began under a Republican president, what are they doing to strengthen it today? Well, they haven't pointed out that of all the eligible families across this country, how many do you think are being helped with the modest amount that is in this bill? About 5 to 6%. In other words, under their proposal, 94%
94 to 95% of the eligible families in America don't get any help through this program. Only something less than a third of all the counties in America have any services under this program at all. If it works so well, why don't we have more of it? Because what we have is big talk and not the dollars that are necessary to fund this valuable program. All that this bill does is to keep the same funding level that existed when the program was first set up, though the need has grown and the cost of programs like this has grown as well. We are not fulfilling our responsibilities when we do not put the dollars in that these programs require. And to say that the deficit won't permit us to do it is to ignore the history of this committee in approving one unpaid tax break after another while neglecting valuable evidence-based programs like this. If this is the way that you treat an effective evidence-based program that your own witnesses support, and you seek to undermine it today, I think it shows how phony the so-called Better Way agenda is as a whole. We ought to reject this bill in whole.
Ms. Noem, you recognize strike the last word.
Well, thank you, Mr. Chairman, and thank you for the great work that you and the Human Resources Subcommittee have done on this piece of legislation. In order to highlight the extent to which you and your staff have been receptive to member concerns, I wanted to briefly mention an issue in which we were able to come to a compromise on this bill. As I've mentioned before, South Dakota is home to 9 federally recognized Indian tribes, and these communities struggle with extreme poverty, drug, alcohol addiction, gang violence, and sex trafficking. And these communities are exactly the kind of communities the home visiting program is intended to assist. However, in previous versions of this bill, tribes would have been required to match the federal dollars. And while I support the idea of matching in concept, a match would be all but impossible for the impoverished tribal governments who have 80 to 90% unemployment in their communities. I brought this concern to you and your staff, and the bill before us today makes a change to that provision. The Chairman's amendment delays the match to allow Congress time to determine appropriate matching levels going forward. Again, Mr. Chairman, thank you for giving us the time for the tribes to figure out how they will do the match, and I applaud your work, and I urge my colleagues to support the legislation. With that, I yield back.
Ms. Noem, thank you for your work on this. You really raised a valid point here. I'm glad we're able to make some changes to accommodate that, but we'll continue to work with you for our tribal visiting grantees. Thank you. Ms. Delbenny, you're recognized.
Thank you, Mr. Chairman. Like many of my colleagues, I strongly support reauthorization of the home visiting program. It's had an incredible track record of success improving child and family outcomes for our most vulnerable communities. And earlier this summer, I got to see firsthand how impactful this program can be. The families who choose to participate in the program receive regular home visits from nurses and social workers, often from the same neighborhood, who help to create healthy and supportive home environments for the children and parents alike. Parents like Jessie from my home state of Washington, who struggled with parenting before she got connected with home visiting. Jessie says, quote, "Home visiting changed my life and helped me break the cycle of poor parenting and verbal abuse," end quote. The results of this program simply cannot be denied. According to the Washington State Home Visiting Coalition, home visiting has been shown to reduce the likelihood of child abuse and neglect by 50%, while at the same time reducing domestic violence, addressing postpartum depression, improving children's readiness for school, and increasing parents' self-sufficiency and economic well-being. It is precisely the kind of evidence-based model that we know gives us a great return. Unfortunately, there are huge unmet needs for home visiting services across the country. Last year, the program reached more than 1,650 families in my home state with more than 18,000 home visits made. But only 1 in 4 eligible families were served by home visiting in 2016, leaving more than 29,000 eligible families in Washington state unserved. That's why I'm so disappointed the legislation we're considering today fails to make the meaningful investments we need to lift more families out of poverty and into the middle class. Now is the time for Congress to be forward-looking rather than always being reactive to ensure that no families are left behind. I'm also disappointed we're considering this bill with only 6 legislative days left in the House before the home visiting program is set to expire, along with the Children's Health Insurance Program, or CHIP, the Community Health Center Fund, the National Health Services Corps, and so many other programs that are essential for the children and families that we represent. It's unacceptable that so many federal programs are at risk due to congressional inaction. We need to be doing a better job of providing families, states, and healthcare providers the long-term stability they need to be successful. Mr. Chairman, it remains my hope that we can move quickly to reauthorize this evidence-based program this year in a way that addresses the significant unmet needs for home visiting services across the country. Unfortunately, the legislation before us today would take us backward, not forward, and we can do better. Thank you, and I yield back.
Ms. Walorski, you're recognized to strike the last word.
Thank you, Mr. Chairman. I want to rise in strong support today of H.R. 2824, the Increasing Opportunity through Evidence-Based Home Visiting Act. In my home state of Indiana, 9 counties are eligible for McVie funds, and 3 of those 9 counties are in my district. In April, I had the pleasure of visiting with state and local officials, staff, families at Healthy Families St. Joseph County to hear firsthand the good work they're doing to provide voluntary home visiting to over 800 children and families each year. One parent told me, she said, I distinctly remember being in the hospital and thinking to myself, I'm a single mom. I have no job. I don't have a good place to live. I have very little money, and I don't care what anybody tells me. I'm not ready to have a child. But with the help of Healthy Families, she turned those long odds into success. She called Healthy Families a miracle. This program gave the mother confidence to raise her son, gave her son a shot at thriving and developing that he may have never had. Now take that one mother's story and think about the fact that home visitors helped over 2,600 families in Indiana in fiscal year 2016. Thousands of families changed for the better. Thousands of parents and children are getting a better chance of health and success. Mr. Chairman, McVie is a program that gets results. It works. We all know that. We know this because of the statistics, but we hear it in their stories too. Parents get the tools and the confidence they need to be good parents. This improves outcomes for their children in their early critical years and sets them on a better path as they grow up. And the program helps identify and root out deeper issues like drug abuse, domestic violence that destroys families and hinders a child's development. If there's one thing I've learned is I've heard from people who successfully broke the cycle of poverty in my district, it's this. It's one thing to provide money, but if that money comes in a one-size-fits-all basis, people can't break the cycle. Checking a box doesn't break the cycle. Human interaction, looking at each person as an individual and not just a number, resolving underlying issues unique to each person's situation, having another person come alongside and say, I'm with you, I'm here to help. That's what breaks the cycle. McVie is a great example of a program that does this. I fully support this program, urge my colleagues to send this bill to the House floor, and I yield back.
Thank you, Dr. Davis. You're recognized to strike the last word.
Thank you, Mr. Chairman. H.R. 2824 redefines success to require that any program, including a benchmark related to improvements in family economic self-sufficiency, include increased employment and earnings. The Ulcer Prevention Program, run by the wife of the Republican governor of Illinois and the First Lady of the state, has a wonderful home visiting program using parents as teachers for homeless families with the Primo Center for Women and Children. It has wonderful outcomes of decreasing trauma symptoms in parents and children, improving social, emotional, and health child development outcomes, and improved parenting, reducing child maltreatment. Similarly, the Children's Home and Aid Society of Illinois is leading a unique home visiting program with pregnant and parenting foster youth. This program focuses on improving parent-child relationships and child development. Neither is a job training program. They do not train participants for employment or work with participants to directly increase their earnings. The ounce is renowned for its work to improve child development. So under H.R. 2824, if these programs do not have employment outcomes, they would fail the evidence standard of improving family economic self-sufficiency. Is that correct?
Dr. Davis, we're in the strike the last word
All right.
Section rather than the technical
See,
amendment section.
thank you. See, many programs actually do work, and they work on parent self-sufficiency. But these are not the narrowly defined activities of employment and increased earnings that the Republican bill insists on. I also have concerns because this Republican bill adds a new overly strict provision that programs must increase outcomes in at least 4 of the areas. So programs like this wonderful program by the Ounce of Prevention, run by the First Lady of the state of Illinois, will be at risk of failing these new, very restrictive parameters that do not relate to home visiting and apply an unrealistic evidentiary standard. So for these reasons, I oppose the program itself and will in fact introduce a substitute. And I yield back.
Mr. Meehan, you recognize to strike the last word.
Thank you, Mr. Chairman. I want to begin by expressing my appreciation for Chairman Smith and the hard work he's done in trying to find a way to enable this important program to move forward. Experiencing firsthand and seeing what has been done with the Nurse-Family Partnership in my own district with respect to the interventions with young women and how it has impacted the lives of their families, particularly with respect to the development of that young child, has been remarkable. And so one of the things that's unquestionable is the agreement in the value of this program. What stuns me is the continuing effort to sort of undermine it somehow. We haven't met the challenge. In fact, if my record is correct, when the ACA started this program, they funded it at $100 million. So the very people who controlled this issue only put $100 million into it. It's up to $400 million under Chairman Smith, and I applaud him for that. And the thing that I am finding is that those organizations in my community are looking for consistency and the ability to rely on the long-term stability of this program. And the intermittent uncertainty with regard to, stop, start, that uncertainty has been a bigger impediment because, in fact, it has served in a way to galvanize the community. And I am watching not only the match from a local perspective actually double that impact, so that they're not only meeting the requirement that Chairman Smith is hoping to, they're exceeding it. Grant programs are looking for places where they can continue to find evidence-based impacts. And that's what this program does. And to sit and look now at the technical questions that may sit in the way, and with all due respect to my good friend who I think has a remarkable sense for his community, and I always respect listening to his perspective, but I also appreciate that Chairman Smith has put in alternatives in which there are guidelines, but you have to meet metrics in 4 of 6. I look at this, and most of the programs are running 6 for 6 without any question. So this has been good work. I appreciate the work that has been done, and I really urge my colleagues on both sides of the aisle to listen to those in the community, give them the chance to go out and do this innovation. They're the ones that are delivering with their own inability to integrate with that family and saving the dollars down the line, turning this all into, well, there's just one more dollar that has to be put into it. They need certainty. They need the ability to go in and do those interactions and make a difference in the lives. Chairman Smith and his committee have worked in a tremendous fashion to put this in a way that recognizes not only continuing high level of support, but the incentive which communities are drawing to. So I just really hope that these impediments to progress don't continue, and the colleagues on both sides of the aisle will roundly support the good work that's been done and vote this out unanimously.
Thank you. Are there amendments to the amendment in the nature of a substitute? Mr. Pascrell, you're recognized.
Thank you, Mr. Chairman.
For what purpose does this gentleman seek recognition?
Mr. Chairman, I have an amendment to this bill.
Thank you, Mr. Reichert.
Reserve a point of order.
Point of order has been reserved. The clerk will distribute the amendment. And I ask the gentleman to suspend while the clerk distributes.
Thank you.
Thank you.
Give me a minute.
The gentleman from New Jersey is recognized for 5 minutes.
Thank you, Mr. Chairman. I want to begin by simply saying, with all due respect to a gentleman who I hold in very high esteem, my friend from Pennsylvania, and to all the work that Mr. Smith from Nebraska has put into this, and I don't say that in any light manner at all. This is not an easy subject, but I want you to know the amendment I'm presenting today, Mr. Chairman, has the support of the following groups: the Association of State and Tribal Health Officials, the Home Visiting Coalition, the Ounce Prevention Fund, Home Instruction for Parents of Preschool Youngsters, Prevent Child Abuse USA, Healing Families America, Parents as Teachers, Nurse Family Partnership Association of Maternal and Child Health Programs. My amendment, Mr. Chairman, would strike the provision of the bill that would add a state match requirement for MICV, the program of Maternal Infant Early Childhood Home Visiting. Make no mistake, the state match requirement is a cut to home visiting programs in the communities that need it most. So in fiscal year 2016, the state of New Jersey received $10.5 million in federal MICV funding. New Jersey invested $4.2 million in state and local funds for home visiting. So based on the current fiscal situation in my state, I'm not confident that they would be able to come up with the money. Where does this leave the families that rely on this program? So this is not a technical change I'm putting forth in this amendment. This affects real human beings. Congress specifically targeted MICV funding to the most at-risk families and communities. State matching requirements directly interfere with that goal, since states and communities with the most need may have the fewest resources to make required contributions. Rhetorically, is this what we really want? So many of the poorer states, those where home visiting is needed the most, will be simply unable to meet the requirement and will lose their federal dollars. I have a list of every state in the union and what they have provided and what they haven't provided. This will be particularly true on Indian reservations and in other tribal populations, where extreme poverty and limited resources are a tremendous challenge. I also expect some state legislators legislatures to refuse to provide a match simply because they don't like the federal government telling them how to spend their money and are willing to let families and children be collateral damage in a war with the leaders of this Congress. That doesn't solve anything. Several state MCV programs are already administered by nonprofit organizations because the state chose not to accept the federal money or to choose not to run it, the program. So it seems unlikely that those states will put up a match so they can keep serving families in need. Similarly, many Indian tribes refuse to participate in matching programs because they consider them a violation of tribal sovereignty. Even for states that believe they could meet the requirement as it is currently constructed, this is a dangerous path. States are already subject to a maintenance of effort requirement. This bill would raise the bar on states as a condition of receiving the same money, not new money, and states are understandably concerned about what will come next. For states that do try to meet the match requirement, there is considerable risk and uncertainty. Let's take the current situation of Harvey and Irma. I think these are good examples. States dealing with those major disasters may need to focus state resources on recovery in the next few years, perhaps including diverting funds which had previously been invested in home visiting. That's not good. The match requirement doubles the penalty to a state anytime a source of funding for home visiting is withdrawn. We're punishing the very people who need this. If a private funder, the state legislator, or a local community stops providing support for home visiting, the state will lose that funding, and all of the federal MCV funds that is matching. The uncertainty here.
Gentleman's time has expired. Does anyone, Mr. Riker, do you recognize?
I withdraw my point of order.
Gentleman withdraws reservations. Mr. Smith, you're recognized to speak on the amendment.
Thank you, Mr. Chairman. I respectfully oppose this amendment. I think it is highly important that we generate relationships with states that are productive or continue to foster relationships that already exist. It's been interesting. I've had to verify whether or not we're talking about the same bill here as some of this discussion has been taking place. There have been characterizations of the bill that say there are changes that are actually similar. The dynamics are the same in many ways as 2010. But I think it's important to note that I think more effective programs are those which generate support from the states through a match. When you look at the dollars already that exist as matching funds today, it would amount to about $340 million. States already doing that today at varying levels, some more than others. Mr. Schweikert points out in Arizona how eager the state is there to support this effort. We require matching dollars for various other programs, from TANF to foster care, child welfare, and others. But let's discuss the benefits that states would experience or are experiencing because of this, as I pointed out earlier. But let's look at decreased hospital admissions. How much is that worth? Increased school readiness. We know that's valuable. Reduced childhood abuse and neglect. Hard to put a price tag on that, but we know it's important. But it is vitally important that we, as a Congress, engage in a way that is productive, ultimately for the American people, especially those who are hurting. And in a productive way, I think this program has shown, as both sides have indicated already today, this program is very effective. It has bipartisan support. There are some details that don't enjoy bipartisan support. But let's make sure that we focus on the positive here so that the bickering perhaps here in Washington doesn't stand in the way of helping people but ultimately affording our states
Will the gentleman yield?
the opportunity to engage. I would yield.
During the time I served on the committee, I guess I still serve, but served as ranking member, I never heard a single witness come forward and advocate this matching provision. During your tenure this year as chairman, which individuals or groups have come forward and asked for and recommended the inclusion of the provision that Mr. Pasquarel would strike?
Well, I can't speak to every detail there, but I can tell you that there's about $340 million right now that local, states, and even private organizations. There are private organizations.
I understand the amount, but isn't
reclaiming my time.
No one.
Reclaiming my time. Private philanthropy is also spending almost $40 million, which would qualify for the match, and spending other federal dollars on evidence-based home visiting as well. That's greater than $70 million in cash assistance, child care, and child abuse prevention. But of all the things that we should work together on, I would hope that we can work together on this and in concert with the stakeholders across our great country, where I know that local and state officials and entities are working their tails off to make a positive difference. And this bill is a reflection of an exchange of ideas and reflection of needs across our country. I yield back.
Thank you, Mr. Thompson. You're recognized to speak on the amendment.
Thank you, Mr. Chairman. I want to revisit the question that Mr. Doggett asked. Who supports this matching requirement? The answer, Mr. Smith, is nobody does. All of us have spoken regarding... Certainly.
It's very human to not want to offer matching dollars. That is a very natural thing for a lot of entities. And so please acknowledge, I'm sure that other matching entities would love to strike the matching requirements of other programs, but we need to look at what the result is of working together.
Reclaiming my time, I won't dispute that, but the point here is these are programs, this is a program that serves a very unique universe. And I mentioned in my original comments about the tribal relationship with this program. You asked who benefits. You said who benefits from not being in the hospital and being better students. Well, tell me how my dirt poor tribe that is going to lose the program that they have because they just don't have any matching funds. How do they benefit? The answer is they don't. You know, not every tribe is a wealthy tribe with gaming resources or natural resource monies pouring in. This is the tribe that I talked about in my opening statement is dirt poor. And this program helps those kids on that reservation. And what your amendment is going to do is going to deprive them of this program and deprive those kids of help. Poor communities throughout the different states depend upon this program. And as was pointed out earlier, we're just scratching the surface with this. Everybody agrees it's a great program. Everybody wants to see it expanded. And there may, in fact, be matching funds someplace. There may be, as you point out, private sector matching funds. There may be states that can do it. But not everyone falls under that same umbrella of wealth and ability to generate those matching funds. And the amendment that you're offering is going to hurt kids. It's going to reduce access to this program, and that is directly in conflict with the bipartisan support that you were talking about that this program has received.
Would the gentleman
yield? To balance my time.
Would the gentleman yield briefly? So first, this is the Pasquarel amendment, not the Smith amendment. Secondly, is your main concern about the match for our tribal home visiting grantees? So I think this is a fair point. So Ms. Noem had asked for a 7-year timetable to be able to match these funds. We'll continue to work with you in these areas on our tribal challenges because I think it's a fair point. So let's continue that conversation.
Well, Mr. Chairman, thank you for that commitment. But the point is that continuing to work with us to deal with this doesn't address the fact that this bill, without the Pascrell Amendment, is going to take these funds away from this particular universe and is going to deprive these kids from the benefits that Mr. Smith rightfully highlighted come from this program. This is a distinct disadvantage to the communities that, on a bipartisan, in a bipartisan manner, we all want to address. And yes, I would yield.
I will add that the bill currently includes a time provision that accommodates more time given to the tribes to work on this very issue. So I think we could work together in good faith to resolve some challenges that I think we want to resolve.
Reclaiming my time, you can give them as much time as you want, but if they don't have any means to generate that money that would be used for the matching grants, I don't know what you accomplish. You know, you're ending the program, and the time provision is a distinction without a difference. There is no way that some of these folks are going to be able to come up with the money to make the matching requirement, and they're going to lose the program. The kids are going to lose the benefit, and then the benefit that you talked about, the deferred hospital or the avoided hospital cost, the avoided educational cost, those are going to be heaped right back on our society as a whole. Yield back the balance of my time.
Mr. Meehan, you're recognized to speak on the amendment.
Thank you, Mr. Chairman. Again, I sort of struggle with this, thinking that somehow people are going to come in and be happy to try to meet a match. I look at the word that was principal to, I think, something we've heard so many times, the nurse-family partnership, the concept of partnership. And I don't know why it's unrealistic to expect that the benefits that have manifested themselves, in which what really the chairman is trying to do is to take evidence-based programs that are demonstrating their effectiveness. And oftentimes the impacts are far more noticeable back there on the local level, the state and local level, where they have an actual incentive to try to get there. And I just find it where we have $400 million dedicated to this program, and evidence indicates that there's already $340 million in state and local matches. It seems to me that that's not that big of a difference in the form of nationwide the ability, as I have articulated, and I know the gentleman from New Jersey is facing budget issues as a taxpayer in a home in New Jersey, taxation without any representation. I frequently struggle with how New Jersey identifies its priorities. I think my friend as well may from time to time. But the point of it being, I have watched as the governor there has focused dollars towards heroin care and other kinds of things, and opioids, and I can't imagine that that same recognition of the value in this partnership wouldn't be realized by states participating in it. I'm proud to say that in Pennsylvania, I have watched our state and local officials not only meet that match, but exceed it. And they've exceeded it because they've taken the time to work together in partnership and have recognized the outcome value in terms of dollars realized down the line. But it's really more the value of lives that are impacted down the line in such a positive way, and savings to the entire system that often fall on the state. So it's a question of priorities, and asking the state to step up and participate in such a way does not seem to be out of the realm, as opposed to just simply relying on the federal dollars to give us more and to give us more when we don't have the money to give. And that's the struggle that I look at, is how do you do this when you don't have the money to give? We're stretching to give as much as we can and say, hey, meet us there too, state. If we can come together in this partnership, we can get all of this together and produce a better outcome. And for that reason, I'm going to encourage my colleagues, regrettably, to to not support my friend's amendment because I think it works counter to the idea of giving people a reason to get to a place where they ought to be getting, rather than letting them off and just saying, hey, don't worry, the federal government's going to come in and dump more in when we don't have it to give. I hope we can find a way to get here because this is a program that can make a difference. Thank you. I yield back.
Thank you. Mr. Doggett, you recognize.
Thank you, Mr. Chairman. You know, in theory, I agree fully with Mr. Smith and the concept of requiring a match. The idea of just giving an unlimited amount of money to the state with no strings attached and not requiring the state to put some dollars in is one I have a problem with. But like so many other theories, there's a big gap between the theory in Washington and the practice in the field. And we need to look closely at this measure, which really is nothing more than an attempt to create another obstacle to the effectiveness of these programs. I asked Mr. Smith, and he deferred, whether in the last few months things were any different than the last few years with regard to Republican and Democratic witnesses coming before our subcommittee and asking for a matching grant. The truth of the matter is that not one witness has ever come before the Human Resources Subcommittee and said, you know what we need? We need to have a state matching requirement. Because as a practical matter, it is a big obstacle. And let me give you a very specific and timely example. The state of Florida, and I know Mr. Buchanan's not here because he's down there dealing with the disaster that is Hurricane Irma. The state of Florida has not put a dime in matching funds for home visiting. The home visiting programs that operate effectively there because of a provision in the existing statute have received their money directly from the federal government, and many of them are doing an outstanding job. How likely do you think it is after the disaster we see played out on our television screens every night that the state of Florida will next year be able to match home visiting funds? The effect of this amendment is to terminate those programs because Florida, which has not been willing to provide the money in the past, faces so many other obstacles, they're unlikely to want to provide the money in the future. And we have plenty of experience with matching and non-matching. We have discussed in this committee that we set up a system of health care that relied on Medicaid where the match was initially 0 and eventually it went up to 10% for the states, and yet many states, including my own, refused 100 cents on the dollar to insure more of their citizens. And as a result, we still have the largest percentage in the country in our state. In Texas, there is some independent state funding that existed through the Nurse Family Partnership Act, Nurse Family Partnership Program for these initiatives. But given the fact that the state only this year terminated, as it looked for savings from poor people, terminated a program that has provided for many years similar assistance to families with a child with disabilities in the Texas Hill Country. There's no guarantee those dollars will be there in the future, and that the Texas match will be there because Texas is also struggling with hurricane recovery. And so as a practical matter, to put up a roadblock that no one has asked for other than some of these far-right ideological groups that are in their own ivory towers and who think that any way you can reduce federal social services, even those that work, they're the only ones that have advocated this. And for the record, I just want to correct the information that Mr. Meehan provided about the funding of this program. It was originally a $10 million demonstration under President Bush. We authorized $500 million in the initial program, but in an effort to ensure that that money was not wasted as the program began to ramp up, only $100 million was obligated in the first year. All of it has been spent since that time. And now the program is $400 million a year. So this program that they praise, that we've heard so many people talk about, that has been so effective, that accomplishes so much, it has $100 million a year less than when it was originally set up. And they propose to freeze it at that level, not because, as he says, that's the result of how we strengthen the program, not because it's the better way, but because they're simply not willing to put adequate resources where their big talk is. And as a result, many children across this country, not just in the tribes, not just in Florida, but in many other places, will suffer from inadequate services that could have been provided, that do work, that Republicans and Democrats agree work, but are unwilling to fund. I yield back.
So thank you, Mr. Doggett, just recognizing myself. So some corrections here. Federal government already requires states be partners in a number of critical programs, foster care, adoption assistance, Medicaid, and child care. In other areas like foster care administration, it is a 50% match. It's an equal partnership. So it is with education training when it comes to food stamps. We want families to be able to work their way off of that. Also, the cash welfare program we have requires states to maintain 80% of what they've done in the past. So having a partnership, as Mr. Meehan and Mr. Smith have talked about, is pretty traditional. In states like Florida, just to correct the record, in this area of home visitation, provides almost 4 times as much match for this program, $4 to $1. So they far exceed it. So does Arizona, Massachusetts, Michigan, Missouri, same as well. New York provides almost $5 for everyone from the federal government. They think this is an important program. North Carolina, Ohio, Oregon, and Pennsylvania. And just to put it in perspective, this bill requires a very slow glide path over 5 years, and states have already reached 80% of the goal. Here we are on day one.
Well, the chairman
in a 5-year plan moving forward, and so look, it's a fair requirement to be equal partners with plenty of time for states to be able to meet that. Many already exceed. And then we would like to continue to have the conversation on the tribal side.
The Chairman,
Mr. Doggett.
What were the figures that you had on Florida there?
Florida provides $40 million, a little over $40 million.
I believe that figure is accurate, but none of it is provided by the state. And your bill, as written, requires the state to do it. That's how much is spent.
No, I don't believe it does. Actually, it allows the private foundations and others to match it. So, yeah. No, not this time, but I will be recognizing you in a moment to speak on your amendment.
Mr. Chairman?
So, Mr. Pascrell, you're recognized. What's that?
Mr. Chairman.
So, Mr. Pascrell, I might note you've spoken on your amendment already.
That is
so
correct.
We'll need one of your colleagues to be able to yield time to you.
Mr. Chairman?
Yes, let's go in order. So, Mr. Levin, you're next, if you'd like to yield. Then Mr. Lewis and Mr. Neal. Okay?
I yield to Mr. Pasquale.
Pasquale,
Save me a minute, if you will.
Thank you. Mr. Chairman, Florida doesn't provide any state money. I'm looking at the record right now of every state in the union. And interestingly, it provides very little in terms of private funding from the organizations there. So here's the point we're trying to make. The state may think it's important, but if it can't come up with the money, that's the bottom line. I'm not talking about good intentions here. There is not one word that I've spoken so far, my friend from Nebraska, that indicates that I'm questioning any of the benefits that you've mentioned. That's not what the issue is here.
No Democrat participation.
The issue is whether or not this amendment passes, we're putting an extra risk into the program. That if the state doesn't come up with its share, services, the benefits that you've talked about will not be forthcoming or implemented. So I ask you to consider this. The uncertainty that I'm talking about here today is particularly extreme in states where social services programs, and they're different in every state. I understand that. The needs are different in every state. Those programs are generally administered on a county level. In those states, each county will be at the mercy of other county funding decisions. That's how it works in other programs. So if one county shifts enough resources out of home visiting, it might result in a loss of funding for the entire state. That's how it works. So states have also said that it will be difficult for them to track what resources localities may be providing and whether all those resources are going to evidence-based models as required by MCFE. That's what is required in law. States that currently rely on funding from private foundations will also be at risk. Those foundations usually provide startup funds to get programs going and then move on to the next worthy cause. If they continue that pattern, states that have just gotten home visiting going in needy communities are likely to lose all their home visiting funding instead of just a foundation funding. I ask you to consider that, please. I have many questions about timing. Home visiting is a long-term intervention, usually lasting a year or more. If a state loses part of its match funding and is penalized by also losing its federal funding partway through the year, will it have to cut families off immediately? Talk about skin in the game.
Mr. Pasquale, would you like to reserve the final minute for Mr. Levin?
Yes.
Okay, and others will yield to you.
When you get
Let me just express, I think the frustration of all of us on this side. There's no question about the need to look at this, including the issue of partnership. But if the Republicans on this committee and the subcommittee could not sit down and work with Democrats to write this bill, it is a sign of hopelessness that we're going to be able to sit down and work together to write legislation. There was, as I understand it, and I've been through this with Mr. Doggett during previous years, there's a frustration that you just, even on this bill that started with an experiment under President Bush and then under President Obama, just still in its experimental stage, that you couldn't sit down and see if you could work out these issues. So instead, what you have is confrontation. And you're going to end up rejecting all of our amendments, and all of us Democrats will vote against a bill, I think, because of your failure to sit down on this issue to work out a bipartisan solution. That's the sad aspect of today.
Mr. Lewis, you're recognized to speak on the amendment.
Mr. Chairman, I move to strike the last word and yield my time to Mr. Pasquale.
Yes, sir.
Mr. Chairman? Recognized? Okay. So let me then repeat, Mr. Chairman, my final statement before, and that is if a state loses part of its match funding and is penalized by also losing its federal funding partway through the year, will it have to cut off families immediately? Will it have to cut off even more families in order to repay past grants to the federal government? The bill claims to allow states to use other federal funding as a match for these dollars. This is what the bill says. I question whether that is legally possible, since many of the other funding streams have rules prohibiting this kind of use. And Congress has a long history of punishing states for using federal funds to match other federal funds, even if it is legally permitted. There's a history here. But even if this practice will be allowed, let's say some magic wand allows this to happen, most of the federal streams that would be part of the match are under direct attack in the Congress of the United States by the Republican Party, even if it's allowed.
Will the gentleman yield for just 10 seconds?
Sure.
Just quickly, so I know you want to really be accurate. And so today, states are already spending other federal dollars, about $70 million.
Right.
Cash assistance, child care, and child abuse prevention, because they believe in this program and are willing to do that.
Right. I understand.
I yield back. I apologize.
I understand the states that are putting in, and I understand the states that are not putting in. I don't want to take that risk. You do, if I understand you correctly. For example, Republicans have repeatedly tried to slash Medicaid. And by the way, the example that was used before about the opioid addiction in this country, the scourge of this country, we've attempted to cut in the last 5 months, 4 months, Medicaid. Money goes from Medicaid into these programs, into the states, to help us with this epidemic. What are we talking about here? The Temporary Assistance for Needy Families program has lost a third of its value in inflation since 1996. And the president proposed in his budget to cut it by another $22 billion over the next 10 years. You can't talk out of both sides of your mouth. Let's get down to the skin in the game, people's skin. Republicans on the Ways and Means Committee have voted twice in the last 5 years to eliminate all funding for social services block grants. Another source the majority has suggested could be used for the match. So this amendment is supported by a lot of people, as I mentioned in the beginning, a lot of groups. Mr. Chairman, the state match provision included in this bill is bad for the program and the families it serves. I urge my colleagues to think this over, to come together and work together. I don't really think we're as far off as you think. I yield. I'm sorry? No, I'm done. I'm finished.
Thank you, Mr. Pascrell. Mr. Reichert, you're recognized to speak on the amendment.
Yes, sir. Thank you, Mr. Chairman. I yield my time to Mr. Smith.
Thank you. I appreciate that. I won't get into all the details in the interest of time, but I do have a timeline here, a very public record of what, most of it, a public record of when we have held hearings, when we have reached out. Yes, there was a disagreement on whether or not to cover additional costs or how we would go about that. And a lot of these are good faith disagreements that I would hope we could work through. Now, it's been pointed out that different states do things different ways, and I would imagine there might even be some members of this committee who disagree with how their own state does some things. That's why I think it is very important to have a very flexible match in this case that says, hey, let's work together on this with stakeholders, with local entities, state entities, who have a lot to benefit or a lot to gain from the forward motion of this bill. But let it be known that there have been very ample efforts to work together to bring resolution to this. And the time is not mine to yield. I would yield back to Mr. Reichert should he wish to use it. Thank you.
I yield back.
Thank you. Does anyone else wish to speak on the amendment?
Is there any more time? I just want to respond to the chairman.
If I may, Mr. Levin, or Mr. Neal is recognized to speak on the amendment.
Mr. Chairman, I yield my time to Mr. Pascrell.
Thank you. Mr. Smith, flexibility is a very interesting word. We use it in domestic and in foreign on foreign issues as well. But it's a camouflage word. It's used by Democrats and Republicans. It's certainly not absolute, because the flexibility could lead to no program, actually. If nobody comes up with any money to match the federal dollars that are going to the state, there is no program. That's what I'm concerned about. And I can't believe, since I know how much work you put into this, I know you studied it, I know you went state by state, I know you go to the counties to see which our counties are needy and which are not, and what happens in the program, and you trace the dollars. I recognize that. That didn't come here yesterday. But the point of the matter is, if it doesn't happen, that's what I'm concerned about, and I know you are. So you can't punish people that are eligible for the program because the state or some private group did not come up with the money. That's what I'm saying. Or you're saying, well, you're just out of luck. When you talk about skin in the game, and I hate to use the term, but it was used on the other side first, so I can use it now. But this is skin in the game because the people are going to suffer. Families are going to suffer, and we know how beneficial the program is to those very, very families. So we're not giving anybody a blank check. I'm surprised we haven't heard that today yet. This is not a giveaway program. I think that this is a program that's very important to us. It may not be zillions of people that we're talking about, but we're talking about very people who are vulnerable. I know you care about that. I want you to know I care about that too. There is no reason under the sun that we could not have come up with something better than, too bad, Harry, your state isn't in the game. They don't have skin in the game. That's not acceptable to me. I can tell you that right now. I ask you to reconsider. I'm more than happy to sit down with you, and I yield back to the chair.
Thank you, Dr. Davis. You're recognized to speak on the amendment.
Thank you, Mr. Chairman. You know, I've listened very intently to this discussion, and I appreciate all the passion that has been expressed on both sides. I appreciate the work of the chairman of the subcommittee, Mr. Smith, the intent of the legislation. But the real deal is at the end of the day. At the end of the day, the state match requirement in this bill to cut home visiting for the communities that need it the most. Just as we talk about evidence-based, we can also talk about facts. The fact of the matter is that many of our states across the country, and not just on the East Coast, have experienced tremendous disasters. Disasters. I looked yesterday at television at the Virgin Islands, and I wonder how they would be able to match anything. I just don't know how they could possibly do it. I appreciate all of the intent, but I was told very early in life that you cannot get blood out of a turnip. And no matter how you squeeze it, tease it, you can't have rain, as Frederick Douglass was fond of saying, without the thunder and the lightning. If we believe that the programs are as good as they are, we're talking about cutting and forcing states to come up with matching money that they don't have and don't want to put in. When we've had 826 organizations that asked us to double funding. 826. I don't imagine that those individuals were just whistling in the wind in their minds. So the realities are, I appreciate the debate. I appreciate the intent. I appreciate the work of the committee, but requiring states to match is a poison pill for this legislation. I will not accept it and will not be able to vote with that provision. And I yield back the balance of my time.
Thank you, Dr. Davis. As we move to a vote on this, one of the members asked what the source of the funding was. The Congressional Research Service provided those amounts for us. It was asked, so what does match these? So a state and local government can spend their own dollars, nonprofit or foundations spend their own funds, or donate goods and services to do that. They already do that to about $40 million or so, and the state can redirect other funds to that to match it. And right now they redirect about $70 million toward it. So just to sort of respond to that. So the question is on agreeing to the amendment offered by Mr. Pascrell. All those in favor signify by saying aye.
Aye.
Those opposed, no. In the opinion of the chair, the noes have it. Is a roll call requested? Yes,
Roll
Mr.
call.
Pascrell requests roll call. The clerk will call the roll.
Mr. Johnson? Mr. Johnson, no. Mr. Nunez? Mr. Nunez, no. Mr. Teaberry? Mr. Reichert? Mr. Reichert, no. Mr. Roscom? Mr. Roscom, no. Mr. Buchanan? Mr. Smith of Nebraska? Mr. Smith, no. Ms. Jenkins? Ms. Jenkins, no. Mr. Paulson? Mr. Paulson, no. Mr. Marchant? Ms. Black? No. Ms. Black, no. Mr. Reed? No. Mr. Reed, no. Mr. Kelly? Mr. Kelly, no. Mr. Renacci? No. Mr. Renacci, no. Mr. Meehan? Mr. Meehan, no. Ms. Nome? Ms. Nome, no. Mr. Holding? Mr. Holding, no. Mr. Smith of Missouri? No. Mr. Smith, no. Mr. Rice? Mr. Rice, no. Mr. Schweikert? Mr. Schweikert, no. Ms. Walorski? Ms. Walorski, no. Mr. Curbelo? Mr. Bishop? Mr. Bishop, no. Mr. Neal? Mr. Neal, yes. Mr. Levin? Mr. Levin, yes. Mr. Lewis? Mr. Lewis, yes. Mr. Doggett? Mr. Doggett, yes. Mr. Thompson? Mr. Thompson, yes. Mr. Larson? Yes. Mr. Larson, yes. Mr. Blumenauer? Mr. Kind?
Yes.
Mr. Kind, yes. Mr. Pascrell?
Yes.
Mr. Pascrell, yes. Mr. Crowley?
Yes.
Mr. Crowley, yes. Mr. Davis?
Yes.
Mr. Davis, yes. Ms. Sanchez? Mr. Higgins? Mr. Higgins, yes. Ms. Sewell? Ms. Sewell, yes. Ms. Del Bene? Ms. Del Bene, yes. Ms. Chu? Mr. Teaberry? Mr. Buchanan? Mr. Marchant? Mr. Marchant, no. Mr. Curbelo? Mr. Blumenauer? Ms. Sanchez? Ms. Chu? Chairman Brady?
No.
Chairman Brady, no.
Fire Act.
Okay.
Correct?
The clerk will report the vote.
Get me a quiet.
13 yeas, 21 nays.
There being 13 ayes and 21 noes, the amendment is not agreed to.
Mr. Chairman,
Before
would you repeat the vote, please?
Yes, sir. There being 13 ayes and 21 noes, the amendment is not agreed to. So a vote series has been called. It's a fairly lengthy vote series. The committee will stand in recess subject to the call of the chair.
Actually, would have been 30, 21 to 16. So we got votes now, right?
Yes, you have 31 votes, I believe.
How many? 31 votes?
Testing, testing, 1, 2, 3, test, test. Now it's okay. Okay. Testing, testing, 1, 2, 3, test, test, 1, 2, 3. Test, test, 1, 2, 3, testing, 1, 2, 3. So the microphone is okay. Testing, 1, 2, 3. This microphone is working fine. Okay? So there's.
Check, check.
Okay. We'll see how that
Check,
goes.
check.
It's so tall, it's hard to actually get it in. Do you want to get into any of the pictures, Deborah? What? Do you want to get any of the pictures? Yeah, when you're done. Yeah, I would like to have one for the publication. Absolutely. Three, two, one, cheese. Very nice. Of course. Jody, do you want to get one with Tyler? Yes. Keep, hang on to it. Hang on, keep taking pictures.
I just got a new iPhone like a week ago, and it does this movement when I take a picture. Oh, absolutely. Absolutely. Okay, we can do both. With your phone, is this yours? Debbie, did you want the two, you and Byron together? So you would want three, two, one, cheese. Oh, yeah, I should do that. Okay, we're going to do it. I don't know if I like that background.
I don't like the background.
I don't
because
either.
there's a thing right above your head.
Oh, that's beautiful. We should get you under that. Yeah, and the light's not so bright there either. Right. To your actual right. There you go. Sorry.
No, you're right.
As
You're
opposed
right.
to. That's perfect. Three, two, one, cheese. Very nice. Okay. All right. You want to do?
Deborah, you got the pictures you need? Deborah, you have the pictures you need?
So do you want to get one with you and I there? Okay.
If you don't mind. If you don't mind, I'm going to move these things over. Oh, sorry. Absolutely. I'm so sorry. No, you're fine.
Look at me. Everybody.
We're just the witnesses.
Deborah, get in
Like,
there.
we're the witnesses. I never take enough pictures.
Now we've got the committee.
So,
Looking
ready?
good.
3, 2, 1. Let me take one this way. 2, 1.
Let's go. Okay, got it.
It still says Petronchik on the other side, right? Yes. Is it okay? 2 P's. Is it okay? I thought it was SAPP. Maybe this has APP.
I have no idea. I thought it was SAPP, but maybe not. I don't know. No, I think it's A. What have we got on there?
I'm sure you guys know ours.
Well, what did he submit in his testimony?
I definitely looked over this. I think it's.
I don't know, so don't.
Yes.
We don't know.
We're with the other 3 witnesses. So that's the one we know the spelling.
That's why we're acting.
Liz, Melissa, come on. Nice to meet you.
Liz, I'm Kathy Petronchak. Okay. Nice to meet you. I'm sorry. You need to get under there. I'll move this. Okay, I think I've got it now. Just sorry, didn't mean to be in your way.
Oh, I'm Liz.
Nice to meet you, Liz.
Thank you so much for coming.
It's my pleasure. Glad to have this opportunity.
So you were able to drive. Where are you from? In Florida?
Orlando.
Okay, wow.
Yeah, so it was just a little over a 12-hour drive, so not horrible.
It's not horrible.
Are you sitting back here,
15
Melanie?
and you're talking.
Are you guys sitting right here?
Yeah, 12 is doable.
Okay.
And
You're able to
break it up with going, did you stay overnight? No,
Oh,
I
okay.
just took off yesterday around 8 and got in last night, I think, around 8:30.
I was just gonna leave my
It was
stuff
quite the
underneath the
scene, though,
chair when
because,
you
you
said,
know,
like, the phone doesn't
most of
interfere.
Florida got evacuated, and I think a large portion of Georgia did too, southern Georgia.
Yeah.
So it was like wall traffic going south. I was going north, and there was like no traffic, but it was just quite a scene because it was like the National Guard, all these electric trucks just lined up for miles and miles.
Well, thank you.
Yeah, no, my pleasure. Yeah, no, this is something I'm very passionate about, so I really appreciate the opportunity.
Oh, yeah.
I think that's okay. I do. How many times have you testified? Do you even know?
This is the third time. The first time I did, it was one on earned income tax credit, and I was on a panel with Nina, and it was so, because it was my very first, she made me feel so comfortable.
Oh, good.
So, and then
Yeah, she
last year I
testified.
did small business. I'm taking her back.
Yeah, I knew last year.
I did the small business. And you guys could share the testimony now with the TVs.
I know, but I just wanted to be sensitive to it, because you never know.
I'm like, no, there's too many people. Who knows where they're sending it?
My executive committee,
No
in the
worries.
past, not this one, they leave too, so I'm always very careful.
So Dina was like, oh, I'm like, yeah, I know. People, a bunch of people on this board. Like, do we see what those things because even the message he sent to strategic board members, they forwarded on to like other CPAs and it's like,
Exactly. Kathy, do you want me to take your purse? Put
Yes.
Jody back here. Okay. I'll put her right
I am.
This is your purse, right, Chastity? Yeah, to just randomly grab something. Like, where are you gonna sit? I'll just stick it under your chair. It'll be fine. Just want our stuff. They ask us to move. Let me out. Flexible, just on the plan. No, I hear you.
Firm would rather hear from you anyway.
As long as you're not boring. Okay, where are you sitting? I'm gonna go down one more to leave an extra spot for Mr. Seps.
Member mic, testing, testing. Member mic, test, test, test. Member mic, test, test. Test, test. Witness mic, test 1, test 2. Witness mic, test 1, test 2.
Member mic check 1, 2, 3, 4, 5. Standing further away. Testing 1, 2, 3.
The subcommittee will come to order. Welcome to the Ways and Means Subcommittee hearing on IRS reform resolving taxpayer disputes. Before I begin my official statement, I would like to recognize the extraordinary effort of two of our witnesses today that made it up here from Florida. I think you drove from Orlando, so that's pretty impressive. Both Mr. Shin and Ms. Wilson came from the great state of Florida. Thank you very much for your determination to be here. I know it wasn't easy. And let me pause for a moment to thank all our first responders, local government officials, and community members who stepped up and responded to the Hurricane Irma in my home state of Florida. It is impressive to see everyone working together. I'm confident we will continue to work together in the aftermath of the storm as well. Today's hearing is another important step in the process of considering reforms to the IRS. I have stated previously, I do not view this effort as an opportunity to degrade or discredit the good work being done by IRS employees. However, I'm a big believer in continuous improvement. That's been my philosophy in business. We can always get better. In government, like business, we should always be looking ways to improve. In a system of voluntary tax compliant, even with the simplest of tax codes, and ours is currently not one of those, there are bound to be disputes between taxpayers and the IRS. What we hope to learn today is about the experience of those taxpayers. These are folks that have been in the trenches working with a lot of those taxpayers involved in resolving disputes with the IRS. And whether there are ways to improve the current process, I believe there will be. Nearly 20 years ago, the last time significant reforms were made to the IRS, one of the key legislative priorities for Congress was the creation of an independent appeals function. As recently as 2 years ago, Congress reaffirmed the importance of an independent forum when the right to appeal to such a forum was included in the taxpayer's Bill of Rights and codified as a responsibility of the Commissioner. Ensuring the independence and the availability of administrative review process for taxpayers' dispute remain a top priority of this subcommittee. In addition, to be an independent, disputes resolution options need to be accessible and efficient. The process is failing if only large businesses with deep pockets feel equipped to dispute a determination made by the IRS. Individuals and small businesses should not have to weigh the cost of hiring outside help against paying the assessment. For most taxpayers, their only interaction with the IRS is when they file their taxes once a year. But when the taxpayers do not find themselves in a dispute with the agency, they deserve a fair and prompt process. I look forward to working with the ranking member on these issues and to the hearing from our witnesses as we continue our effort to examine reforms to the IRS. I now yield to the distinguished ranking member from Georgia, Mr. Lewis, for the purposes of an opening statement.
Thank you, Mr. Chairman. Thank you, Mr. Chairman, for holding this hearing resolving taxpayers' disputes with the Internal Revenue Service. I welcome you back to Washington, Mr. Chairman. And on behalf of the citizens of Georgia, and especially the citizens of the 5th District, we were able to welcome hundreds and thousands of people from Florida. I went into a parking lot in downtown Atlanta on Saturday, and there were so many cars from Florida. And people had their dogs, walking their dogs through the parks from Florida. We're neighbors, and I want to, in particular, welcome Ms. Wilson and Mr. Shin. I have relatives that live in Fort Lauderdale, and only thing we had happen in my district was some, for the most part, pine trees coming down. I want to thank you for being here today. Before we begin, Mr. Chairman, I would like to take a moment to extend my condolences to you and the millions of Americans who were impacted by the recent hurricanes in the Caribbean and the southern states. As you know, the hurricane damaged homes, downed trees, closed roads, and left about 1 million residents without power in my home state of Georgia. Now our citizens, our people, begin the difficult process of rebuilding their homes, their communities, in their lives. And I hope this committee will work together to do all we can to assist the recovery efforts. Mr. Chairman, I've said it before, and I will say it again. We must approach this effort to reform and improve the IRS with a great deal of care and thoughtfulness. I hope we will take our time to develop bipartisan solutions that serve the best interests of both taxpayers and the agency. For many years, I have cautioned that we cannot get blood from a turnip. As you know, Congress cut the IRS budget by almost $1 billion since 2010. Over the last 3 years, the budget for the IRS Appeal Office dropped 11%, and there are about 24% fewer hearing officers. Today, we will learn more about how these budget cuts have affected the ability of the agency to resolve disputes with taxpayers. Our citizens expect and deserve timely and efficient services. Simply said, Mr. Chairman, taxpayers will not get the level of service that they expect and deserve until we provide adequate funding to this agency. As you know, this is the subcommittee's fourth hearing to explore how we can improve the IRS. We have remained bipartisan and explored a good governance path to examine how the IRS operates and to identify possible improvements. I hope and pray that our work product will be a model for our colleagues. This afternoon, we will also explore how to improve what can be a long and complicated appeal process. Together, we will listen and learn about possible remedies. Some may suggest expanding the number of states that have permanent hearing officers, ensuring the independence of taxpayer conferences, and allowing taxpayers to request face-to-face conferences throughout the appeal process. Above all, Mr. Chairman, I hope we will continue to work together as we have all year to explore and address these issues. In closing, Mr. Chairman, I look forward to hearing from our witnesses and learning more about their experiences with the agency. Again, Mr. Chairman, I want to thank you, my friend, for holding this hearing.
Thank you, Mr. Lewis, and I want to thank you for your thoughts and prayers. And we do have a lot of our family and people that went to Georgia and other states, and I appreciate your thoughts on that. And you know you've got my commitment to work together on a bipartisan basis. We want to improve this together. There's a lot of work to be done, so I look forward to working with you. Thank you, Mr. Chairman. Without objection, other members' opening statements will be made part of the record. Today's witness panel includes 4 experts. Kathy Petrancha, Director of the IRS Practice and Procedures at the Alliance Group. Pete Sepp, President at the National Taxpayers Union. Byron Shin, in our district, we're excited to have him and his lovely wife here today. He's founder and managing partner at Shin & Company, and I think he's probably got 35 years of dealing with dispute resolution with the IRS, so I know that. Chastity Wilson, Principal with the National Tax Office of Clifton, Larson, and Allen from Orlando, and a member of the AICPA. The subcommittees will receive your written statements, and they will be made part of the record, formal record. Each of you have 5 minutes to deliver your oral remarks. We'll begin with Ms. Petrancha. You may begin when you're ready.
Chairman Buchanan, Ranking Member Lewis, and members of the subcommittee, thank you for inviting me to testify. It is an honor to provide comments today. I interact with small and medium-sized businesses in my work with Alliant Group. I also spent 29 years at the IRS and feel this gives me a unique perspective into the examination and appeals process. My testimony focuses on challenges that taxpayers face when dealing with the IRS and what IRS can do to improve the examination and appeals process. I raised 6 issues in my written testimony, and I'd like to highlight 2 of those issues. The first issue is the appeals process. Before heading to court, the final administrative step a taxpayer can take to contest an adverse determination by a revenue agent is through appeals. Appeals is important for so many businesses seeking a fair review of their tax issues without having to incur additional costs to go to court. Taxpayers are appreciative of the opportunity to attend the appeals conference in person. They are not thrilled about the recent change by appeals, indicating that they may not be granted an in-person meeting. Appeals has made telephone and virtual conferences first options for an appeal, only granting in-person conferences in limited circumstances. We believe that not granting taxpayers an opportunity to have an in-person meeting would be highly prejudicial to taxpayers, restrict the ability of appeals officers to adequately judge the credibility of witnesses, and make the conference more difficult in situations where the appeal is of highly technical and highly evidentiary-focused cases. While we have seen appeals officers flexible in granting in-person conferences, we believe that taxpayers should have a fundamental right to meet appeals face-to-face. This in-person conference may be the only way a taxpayer believes there is an impartial resolution with a full understanding of the facts involved. Another issue emerging in appeals is the increased involvement of IRS compliance employees in appeals meetings. This change has created a perception for taxpayers that they may not get an independent hearing and decision as afforded by the Taxpayer Bill of Rights. We believe the only involvement exam should have at appeals is in a pre-conference meeting. In a pre-conference, the originating function can attend an appeals conference to present their views on the issues, the taxpayer's protest, and assessment of litigating hazards in accordance with ex parte communication rules. In a pre-conference setting, exam would leave after their presentation, but as of late, rather than leaving at this point, exam has been invited by appeals to stay for the taxpayer's presentation. When this happens, the entire appeals atmosphere is altered, and there are opportunities for this to turn into an extension of the examination process for a taxpayer. The independence of appeals is hindered when exam plays too great of a role in the appeals process. A representative recently described a situation where in a pre-conference, it became clear that exam had not fully addressed the position the taxpayer had brought forward in its response to the exam team. After hearing the taxpayer orally present their position at the appeals meeting, the exam team made another 24-page submission to appeals to attempt further support for their position on the issue, taking an alternative approach. It seems patently unfair that exam can attempt to continue their process when the case is assigned to an independent forum to make a decision. We disagree with appeals having unilateral decision-making over exam participation in a conference. Taxpayers who feel as if they have already been through a grueling process with exam should be able to have the peace of mind that their case is being given a fresh look by appeals and that the examination is over. Today's comments on the issue of alternative dispute resolution focus on the IRS Fast Track Settlement Program. This program was created to provide an expedited dispute resolution option for taxpayers to mediate their disputes during an examination with an appeals official acting as a mediator. The use of Fast Track has the potential to be a highly effective tool when both parties come to the table willing to reach an agreement. Taxpayers and their representatives welcome the opportunity to resolve as many issues as possible at the lowest level in a cooperative manner. This same sense of urgency should be felt by the IRS. In closing, I commend the committee for its work and oversight in ensuring that taxpayers receive fair treatment and good service from the IRS. Alliant Group looks forward to working with the committee to further improve tax administration, and I'd be glad to take your questions.
Thank you, Mr. Sepp. You're recognized.
Mr. Chairman, Mr. Ranking Member, members of the committee, a number of my predecessors have actually testified in this very room on taxpayer rights issues, so I'm particularly honored that you would ask me here to follow in their footsteps, and we need to follow in the footsteps of all of our predecessors in developing a bipartisan solution to many of the problems that have cropped up since enactment of the IRS Restructuring and Reform Act of 1998. One of my predecessors, Bob Kamen, put it this way. He called it taxpayers' triage. What you need are a number of steps, a number of options in resolving problems between the agency and taxpayers that provide a range of responses. One of them is prevention, of course. We can simplify the tax system. We can educate taxpayers about their rights in advance so they know going into the process of interacting with the IRS what to expect, and perhaps problems can be resolved at that level, the pre-conference level, for example. Then there's basic care. What we have now, of course, is the appeals process and a very nascent alternative dispute resolution process. We're going to hear a lot from the witnesses today about some of the malfunctioning systems within appeals, and especially with the recent evolution in the Large Business and International Division of strategies like designating cases for litigation that can be very harmful to the audit process. I hope we can discuss that in further detail later. But the rise of alternative dispute resolution mechanisms around the world and its relatively flat usage here in the United States, actually declining at the appeals level right now, suggests that we need very serious reforms if we're going to make that process workable in the future. Third level of triage really is intensive care. That's when taxpayers and the IRS have to litigate an issue. And there, taxpayers' access to the courts beyond the tax court level is still highly problematic. Everything from the Anti-Injunction Act to the Declaratory Relief Act essentially prevents taxpayers from enforcing their rights in court in a meaningful manner. Largely their choices are confined to litigating for damages after the acts have already been committed by the agency that have deprived a taxpayer of his or her income or right to earn. The fourth level is essentially post-op observation, as I would call it, oversight. Now, current plans in several of the tax reform options being discussed would do away with the IRS Oversight Board. There are flaws in the Oversight Board, certainly, but I would urge this committee to very carefully consider alternatives to the current IRS Oversight Board, which is essentially paralyzed due to a lack of a quorum. We really need to establish and maintain that kind of consistent oversight in some manner. Specifically, I would make a few recommendations, and again, we can discuss these in detail. The foundation for another taxpayer rights package really ought to be based on H.R. 3220, the Preserving Taxpayers' Rights Act. It's a bipartisan bill. It codifies the right to appeal, and it establishes a more business-like working relationship between the IRS and taxpayers. This will apply to large businesses, small businesses, individuals across the board. Section 3 of that bill, which essentially directs the Secretary to begin developing more dispute resolution procedures at appeals, would pave the way for more effective use of ADR in a number of situations. There are many, many other suggestions I could make that we should look at. The Taxpayers' Bill of Rights Enhancement Act, just introduced in the Senate yesterday, H.R. 2901, which would expand some of the assistance in the Volunteer Income Tax Assistance Program, expanding low-income taxpayer clinics. All of these things need to be put into a package to work together to enhance the progress we have made in Taxpayer Bill of Rights 1, T2, and the IRS Restructuring and Reform Act. And this is the committee where it all starts. Every single piece of important IRS reform legislation began with members of this committee, your predecessors and you now, such as with the RESPECT Act that just passed, coming together in a bipartisan fashion to do better for taxpayers. We can do it, we must do it. I thank you for your leadership.
Well, thank you. Mr. Shen, you're recognized.
Thank you, Chairman Buchanan, Ranking Member Lewis, and members of the subcommittee. Thank you for the opportunity to discuss reforming how the IRS resolves taxpayer disputes. As a practicing accountant for over 38 years and a Florida CPA, I've seen a lot of change.
Hey, can you speak up a little bit more in the mic so everybody can hear?
In my opinion, our focus should be taxpayer service first, improved tone with access, consistent controls, and require fast-track steps. I have a unique perspective, as I have been involved in oversight of the Florida CPAs as a member of the Board of Accountancy Probable Cause Panel for well over a decade. And most practitioners work hard to get it right. It is the handful of marginal practitioners and aggressive taxpayers that try to push the envelope. These are the practitioners and taxpayers that need to be reviewed. First, I'd like to discuss correspondence audits. They have been expanded in lieu of field exams for many individual returns. These exams require responses in a specific period of time. However, the IRS responses are taking considerably more time than the taxpayer is given. These exams have a high probability of no change once the IRS receives the submitted responses. In several instances, the taxpayer's rights have been ignored by the issuance of 15-day letters and then shortly thereafter, 90-day notice of deficiencies, thereby ignoring the 30-day letter, and which grants the rights of the taxpayer for an administrative hearing and appeals, and that also breaks their taxpayer bill of rights. This also prevents the fast-track settlement opportunity. Therefore, I believe a standard that it should exist that the process must be maintained and the service, when it jumps over process, should lose the right to pursue additional revenue, follow the rules, or lose the adjustment. We also should require fast track to prevent the circumstances that are existing today. I next want to speak about field exams. The process has been very taxpayer unfriendly with a litigious and enforcement tone. Over my 38 years, we have reached a new low regarding the respect that the taxpayers and their professionals have with the service. It is as if the taxpayer is guilty and have to prove the IRS wrong. The agents are doing several audits at the same time, and they tend to start and stop during the audit, many of them taking much more than 12 months. This just is not right. We have new rules that are also killing the system. An example is the new partnership exam rules that have brought the process to a state of total chaos. In order to close issues and reduce the time necessary, we talk about the call centers and the local office access. Unfortunately, the wait time on the call centers is extremely long. Overall, my experience has been good once you get to a qualified person. This shows how the service needs to open up access. The service should increase the call center available hours, making them earlier, later, and on weekends. The service has a very good e-service process. However, this has been reduced due to budget cuts. This needs to be expanded back in a much broader sense. The local offices no longer allow walk-ins. This is just not. It's not taxpayer right. It's just not taxpayer first. They need to have reasonable access. Another area of concern is foreign disclosure exams. We are seeing a situation growing with the continued disclosure of foreign assets and bank accounts going to appeals, and the appeals officers feel that they cannot settle. So the issue goes on to offshore technical advisors. Then it ends up all or nothing. We need to give them guidance on settlement. Tax law complexity has created opportunities for debate. The code in its current state remains the #1 problem facing both the service and the taxpayers. Since most of our career has been with small and medium-sized business, I can talk specifically about the challenges in compliance. Identity theft. Since many ID thefts were in Florida, I was also a victim. We should require all taxpayers to have PIN numbers. My information was stolen through e-services on a data dump, and that shouldn't have happened. If we had all taxpayers with PINs, that wouldn't happen. And lastly, I think that I'd like to recommend a separate task force that answers to you, Congress, to assist the National Taxpayer Advocate in developing change in the business structure and processes. Thank you very much.
Thank you. Ms. Wilson, you're recognized.
Chairman Buchanan, Ranking Member Lewis, and other members of the subcommittee, thank you for the opportunity to testify. The AICPA applauds your efforts to address the importance of the IRS resolving taxpayer disputes in a timely, efficient, and cost-effective manner. Today, I would like to share our thoughts on refining the independence and efficiency within the IRS dispute resolution process. I will also address the importance for the IRS to understand the taxpayer's perspective and deliver customer-focused service. First, let's start with penalties. Upon receipt of an IRS notice, taxpayers or their representatives
may determine a reporting error was made. However, if the taxpayer made the effort to comply with the reporting requirements, the taxpayer may request relief from penalties. Frequently, the initial IRS response is a routine denial. This process is currently handled independently within each of the primary IRS divisions. We recommend that the IRS undertake a review of this process across the agency to identify necessary training to ensure a consistent and fair treatment of all taxpayer disputes. Next, let's discuss appeals. Appeals is the primary forum for taxpayers' disputes. Their mission is to resolve tax controversies without litigation on a fair and impartial basis. We appreciate them holding conferences which provide a meaningful and unique opportunity for taxpayers to present their positions. In October of 2016, Appeals made several changes to its conference procedures, which arguably impact the ability or perception to independently and objectively help taxpayers. We recommend that 1, the IRS limit settlement conferences to the appropriate appeals personnel, and 2, they provide taxpayers with the option of a face-to-face conference. In one settlement conference, the appeals officer openly asked the exam team what they thought was a fair settlement. My client asked, how is it possible for appeals to maintain their independence when they're seeking the opinion of the same IRS employee who examined them? Although in reality, IRS employees may or may not have influence over the appeals process, it is hard to view them as objective when other IRS employees are involved. We suggest that once the taxpayer's presentation to appeals begins, they should limit the meeting participants to the appropriate appeals personnel and the taxpayer. In another appeals case, payroll obligations were not met until my client discovered the error. The appeals officer said it took him a whole 5 minutes to determine there was no reasonable cause and asked not to discuss it. In this particular situation, a conversation, much less a face-to-face conference, was considered unnecessary from his perspective. However, from the client's perspective, he was not heard. He was unfairly denied the right to present his case. While it's possible to resolve some issues over the telephone, we think it is important that taxpayers have the option of a face-to-face conference. For larger tax disputes, cases are assigned a team of IRS appeals officers and a case leader who is designated settlement authority. In these situations, we urge the IRS to provide truly independent settlement authority to these case leaders and eliminate the approval process that was recently added. Finally, a customer-focused service approach should extend to all IRS services. It will help reduce disputes in the first place. For example, the IRS should create a new dedicated executive-level practitioner services unit that would centralize and modernize its approach. With a mindset of understanding the taxpayer's perspective, the service will enhance voluntary compliance and increase the public's confidence in the integrity of the service. We appreciate the opportunity to testify. I will be happy to answer any questions.
Thank you, all of you, for your excellent testimony. We'll now proceed to questions and answer session. In keeping with my past precedent, I will hold my question until the end. I now recognize the gentleman from Michigan, Mr. Bishop.
Thank you, Mr. Chairman, and thank you to the panel for your time and expertise. Appreciate it. Lots of questions, so little time. Is it Ms. Petronchek? Pretty good? Close? Okay, good. You indicated in your written testimony, I know you didn't have much time today, but you indicated in your written testimony that there were procedures in place by the IRS during an audit that would give larger businesses an advantage over smaller businesses, specifically having to do with transparency. Can you elaborate on that, and can you tell us, is this something that the IRS is doing as a result of the code, or is this an arbitrary kind of application of the rules?
So with that regards to that, Congressman Bishop, in my testimony, In the Large Business and International Division, they have put out procedures in the publication and indicated that when you are issuing information document requests to taxpayers, that you have a discussion, you identify what the issue is, and you talk about what documents you're going to request so that the taxpayer has an opportunity to have a discussion with the agent and say, well, maybe I don't have those kind of records, these might be more pertinent. But they understand what the IRS is looking at and where they plan on going with their examination. In Small Business Division, that just doesn't happen. What happens is you'll get, a letter saying, you're under exam, and then here's a 4-page document request with everything but the kitchen sink pretty much on the initial document request. And then instead of, as in Large Business Division, when that response is made to that document request, it's expected in large business that they would review that response and then have a discussion with the taxpayer to say, we think it's complete or it's not complete, and it's an ongoing discussion. In small business, you're more likely than not going to find out the results of their review at the end of an examination, which is way too late for a taxpayer to be understanding what issues are in dispute and even have the opportunity to use alternative dispute resolution.
Well, it begs the question then, why are they treated differently? And is this, again, is this a result of the code, or is this something that the IRS is doing independently at its discretion?
Yes. Congressman, it's an administrative practice in the Large Business Division, so it's not required by code, but certainly, although that procedure, some would argue could be improved, it's a drastic change and different from that's afforded to small and medium-sized businesses.
I still don't understand why. Is there, you all have done this before, does anybody understand why small businesses are treated differently than large businesses in this area? It just seems like it's
I personally don't see a reason why they could not integrate some of those procedures into their examination practices. Mm-hmm. It's having the discussion up front that meets the taxpayer Bill of Rights to be informed and know what's going on. So I certainly don't see why it could not become a part of their work processes.
I would agree that it should, although I would say that there has been some negative feedback, even from folks who have experienced audits in LB&I, that the IDR requests are often poorly focused. So this might be a problem that's not only with small businesses, but with the procedural latitude given to the IRS.
Good. I have you indicated that on the in-person exam or the appeal, is the expert for the IRS in the room with the examiner?
So it's actually an appeals meeting, and it's a telephone, or they've moved to virtual conferences in some instance. The appeals officer is in the room. They may have a technical specialist, and under the current rules, they could invite exam to be on the phone as well. So that's a real concern, is that, well, who's on the phone? You've got so many parties. You don't know who's speaking. Whose perspective are you hearing?
Is there a problem with ex parte communication too, in-house?
No, that does not violate ex parte communications, because the way ex parte works, if the taxpayer is invited to attend the conference where exam or compliance will be present, then it's not a violation of ex parte.
I get that. In practice, in theory, you're 100% right, but in practice, it seems that that would be an absolute reoccurring problem.
It could be.
And one other thing, if I might, Mr. Chair, is the appeal process de novo, or is it a continuing process that is your appeal? Does it take up the entire evidence, all the evidence? Do they consider everything, or only that which was considered in the previous review?
So in appeals, they should be considering the information that was developed and presented to them by exam, as well as what the taxpayer submitted, and then making an independent decision. They have, when they changed, I think Ms. Wilson referenced the IRM change, they said, we're not going to hear new facts, new evidence in appeals. We're only going to rely on what's in the file to make our decision. So it should be exactly what's in front of them.
Thank you very much. Thank you, Mr. Chair.
Thank you. I now recognize the ranking member, Mr. Lewis from Georgia.
Thank you very much, Mr. Chairman.
Ms. Wilson, thank you for being here today. I understand that you're the head of the National Tax Office at your firm. What type of issues are taxpayers trying to resolve when they come to your firm?
Great question.
Small issues, big issues, global issues?
That is the unique thing about our firm. I would say they run the gamut. So they are all the way from small $1,000 penalty issues up to very large exams. So, you know, we have a very unique client base, and we target mid-sized business, which by the nature of that, we have all range of issues that we see. You know, recently the significant issues I see are around penalties and penalty appeal. We have a lot of clients in our base that, you know, have been onslaughted with information return penalties. And so we try to help them manage through that process.
In your experience, what are the biggest challenges you and your clients experience in resolving tax issues with the agency?
That's a good question. You know, I think the largest issue is just being heard, making sure that
Do you have a hard time, a difficult time, and sometimes just being heard, just getting a face-to-face meeting?
Exactly. And appeals, as I discussed in my testimony, has dramatically changed that process. I've been doing this for many, many years, where I've focused just on IRS.
You haven't been doing it. You're too young to be doing it for many, many years now. Don't tell me that.
But you know, face-to-face was that was the one time you got to sit down and face the IRS and really talk about the issues. And from a client's perspective, they felt like they were being heard because they sat across the table from that appeals officer. And they could see them listening. They could see the head nodding. And so even if it didn't come in their favor, they felt like they were being heard. When you turn to these telephone conferences, which are now the standard practice, you know, you remove that. And they question whether the appeals officer, my clients do, are even listening, because you get to the end of the conference and it, you know, and I'm not saying in every case, because a lot of times this process does work well. But in some cases, the client just walks away and says, I don't even think they were listening. In fact, I heard keystrokes on the computer, right? And so, you know, I think from the AICPA, that's one of our recommendations, is you really need to look at this new procedure. It's administrative, but you really need to look at it and say, what are we doing to taxpayers' service here? Are our taxpayers really feeling like they're being heard? Because this is their last opportunity, Ranking Member. When they get to appeals, their next option is litigation. And I can tell you in my client base, 99% of them are not going to want to take it to litigation because, again, maybe the dollar amount isn't high enough, or they're just frightened by the whole concept of having to go to tax court.
Are you suggesting or recommending that we need to do more to humanize the IRS and not make it so distant, this unbelievable agency out there someplace? That, how do we go about doing that? What are your recommendations? What are your suggestions? Yes, Mr. Shea.
Ranking Member, that's why I got so choked up about doing it in person. You know, the people that can afford to go to an enrolled agent or a CPA, but there's a lot of taxpayers out there that don't have that access. And having the opportunity to walk in and talk at the local agent office level is so important. And having that face-to-face humanizes the circumstances and the facts and situation, and you actually feel what's going on. Now, granted, we all understand that there's some states that don't even have an appeal officer in them. And so appeal officers have to come from out of state. So like in Alabama, Mississippi, they're coming from out of state just to deal with it. So we have a staffing issue. But having that conversation with an appeals officer is a real opportunity to solve. And having the process that you talked about with the small business audits, It is very much behind a dark curtain, and it's a very scary proposition. And when those taxpayers get those letters and those long 4-page requests, it's intense and a very scary moment. And we don't get the chance, like with a large business audit, to have a face-to-face with the team. And then not being able to pick up the phone and call. We have situations where you'll go on hold for over an hour, it'll be at the end of the day, and at 4:30, they'll pick up the phone and put it back down again, and you restart the next day. That's not taxpayer-friendly.
Thank you. Thank you, Mr. Chairman. Are you back?
Yep. Thank you. The gentleman from Pennsylvania, Mr. Meehan, you recognized.
Thank you, Mr. Chairman, and I thank each of the panelists for your service in dedication, because it's clear that you are here as voices for people who feel that they're, you know, if they're not abiding by the rules, they wonder sometimes just, you know, what's the technicality. They're not people who are out there deliberately trying to skirt the rules or beat the system. So, you know, there is a place for those who are deliberately recalcitrant, but so many others are just caught in the malaise. So I have some questions about trying to get your interpretations to make this a little better. It just seems so much of it is tied to a personal relationship, a sense that somebody's actually listening to me, and let's just resolve this thing while we're here. So I have a couple of questions. One had to do, and I think, Mr. Shin, it was you, that you were saying that there were, or Ms. Wilson, it was you, according to my notes, there were recording errors and penalty situations where there would be appeals, and there were just getting to be routine no's. Now, when I was a prosecutor and you had a case, you might do a declination or you would do a prosecution memo, but whenever there was a decision point, you had to justify it, even though it was all internal in the. Should we be requiring that if there is an original inquiry and there's a routine no set out, that there's a justification that you can know that somebody's actually analyzed the file and said that there's a reason why we're just saying no right now?
I would absolutely agree with you that there should be a requirement to, you know, document what the justification for denial was. And again, you know, there's many a times where we do get the denial and it does appear somebody's reviewed it because they put specific facts in there.
But you're comfortable with that because at least you know you can counsel your client. Here's what it's.
Yeah. But there's been instances where it wasn't read because they've articulated, you know, the way, and maybe Ms. Peronchek can speak to this, but they'll take paragraphs. They've got modeled paragraphs that they can pull from a system to do a notice to a specific taxpayer. And it's been obvious that they just pull those paragraphs and dump them into this letter, and it's very irrelevant to what was even discussed.
So what's the effect on the taxpayer? It just draws it out even further. Have penalties and fines been waived during this period, or is there a further accumulation during the period of time that you're appealing this process?
So yeah, interest continues to accrue while we're going through this process.
So the clock's ticking against the person who's appealing.
Yes, and so, you know, that's a discussion you have to have with your clients. But then, you know, there's been instances where you know, your client will come to you and say, do I pay now? Because, you know, I don't want the accrual of the interest. But then there's a different process. You have to file a different form, the Form 843, to make a refund claim, and it's a different process. And you'll end up in the same place, but, you know, there's a lot of considerations to take in when you're counseling clients of what path to go down. But, you know, back to your point, I think the impact it has on my clients is that we are built on a voluntary compliance system. And, you know, what I've seen in some of this penalty administration recently just is that clients become very discouraged because they truly thought they were being compliant. And then when they get this notice that looks like they weren't even really looked at, it can be very discouraging to them. Now, the positive note I will say is that once we get to the appeals process in the penalty arena, a lot of times we do have success there. But it's that routine just seems to be when you make your initial request, it's just the routine.
Well, maybe you can end that appeals process, because that would be presuming we get to that point where you actually have somebody, now you're talking. But I am intrigued by the concept. I think, Mr. Shin, you were talking about it, where you believe that the presence of the examiner also at the appeal was creating a kind of a piling on. And yet I wonder, to the extent that if you're actually trying to get to a resolution, should there be some capacity for the person that knows the facts to be able to present it to? I know that the IRS person's supposed to be independent, so to speak, but I would believe that if I was doing an appeal, I'd want to have at my availability the person who knows the record.
My experience has been the appeals officers are extremely experienced and knowledgeable on the issues, and if they wouldn't, they'd assign another person. And so they can come to their own conclusions based on the facts as presented that came up, and that file is transferred. They get to see the file.
The file, but you don't have the benefit. So to just explain to me the difference. Why is it preferable not to have that person in the room that knows the record? Well, maybe for another time. Maybe if you have a thought that you want to share with us in written testimony or otherwise, we'd benefited from it. Thank you so much.
Ms. Delmetti, you're recognized.
Thank you. Thank you, Mr. Chair. Thank you all for being here with us today. Ms. Petronchek, I wanted to follow up on comments you made earlier. We were talking about the challenges that small businesses face and the inconsistency that we see for small businesses versus large businesses. What do you think we should do to address these issues? What procedures would you like to see, or do you have recommendations on what you think we could do that would work for small businesses?
So some of the things could be implemented administratively. I think Pete had talked about the IDR process, and LB&I isn't perfect by any means, but those are things from a quality perspective within the service. I think they could take a look at and decide that they want to change those processes for taxpayers and indicate that, gee, when we're developing the facts, it is important to put the human element on it and actually having a discussion with the taxpayer about the information. And although that's not perfect and you'll still have disagreements and still have contentious exams, it is an administrative process that could be implemented by rolling out new procedures for their agents and how they interact with taxpayers on a routine basis. I mean, they're developing the facts. We've all spoken to the independence issue in appeals. So that initial fact-finding, that document request, is critical to a taxpayer feeling like they've had the opportunity to present their position and be heard by someone at the service who's going to be open about what it is they're looking at and the treatment they're going to decide on a particular tax issue. So I don't know that anything needs to be mandated, but the IRS and looking at their procedures could say, I was commissioner of small business, and yes, when I was there back when I left was one of those things I could have looked at and said, gee, there are ways we could be interacting on a much better basis with our taxpayers to make them feel better about the voluntary compliance system.
Thank you. Mr. Sepp, it seems the current procedures for small business leave room for improvement, and I know you talked about that in your testimony as well. You also pointed out in your testimony that larger businesses also have some challenges when it comes to the right to appeal, and I wondered if you could talk a little bit about your assessment of why organizations like members of the CETA Coalition are facing the challenges in dealing with the IRS that you outlined. What are some of those challenges, and why do you think those are happening?
Sure, that's the Coalition for Efficient and Effective Tax Administration. It's a coalition not only of large business groups, but taxpayer advocacy groups, because we're concerned that some of the trends both in small business and self-employed division toward audits, but LB&I, are leaking across to each other, and we're going to have auditing procedures that are taking the worst elements in both divisions to be used against taxpayers across the spectrum. Some of the problems we're facing, designating certain cases for litigation where they might have precedential value, even though there really isn't a clear connection to precedential value or large numbers of taxpayers who might be affected. There's the designated summons, which is a rather extraordinary IRS power for getting information out of uncooperative taxpayers that's being increasingly used in cases where the taxpayers really are being cooperative. And of course, there's the use of third-party counsel to work auditing situations, not to advise, but rather to do things that approach deposing witnesses. But all of this really matters to taxpayers across the board because, again, as everyone has testified here, there is, on paper, a directive to the Secretary to provide procedures for fair and independent audit appeals, but in reality, it's just not happening. And I see this in case after case. Even small business owners who are getting things like the 90-day letter, if they're lucky enough to ever have gotten the 30-day letter in the first place, they think it's a demand to pay tax. They don't even realize it's the revenue officer's report that would allow them to take an appeal to tax court. They don't even understand the basic nature of the process because they're so intimidated by it. And again, this is why we support H.R. 3220 as a start of a package that could begin addressing these things.
Thank you very much. I yield back, Mr. Chairman.
Thank you. Mr. Holding, you recognize.
Thank you, Mr. Chairman. Thank you for holding this hearing. You know, obviously, we don't usually hear from our constituents' interactions with the IRS unless they're negative, and I appreciate the committee looking into ways to enhance this experience. So I'm just concerned about what I think is a new diversionary tactic being used by the IRS to keep taxpayers from accessing administrative appeals. So we all know that cases that are docketed in the tax court are typically transferred to appeals for consideration, are not typically docketed unless they're designated for litigation. And it's come to my attention that the IRS may be restricting taxpayer access to appeals in some cases that are docketed in tax court. And the case that I'm aware of was not designated for litigation, nor referred to appeals, the two standard options for making an audit dispute. And instead, the case was kept in a purgatory type status, waiting for litigation under the justification of sound tax administration. I put that in quotes because that's the term they used. And that was the only option available. The only option available to the taxpayer was litigation. So my question, and I'm going to ask Mr. Sepp to respond first and open up the panel. In your experience as a practitioner, have you or any of your clients experienced something analogous to this?
I should state I'm not a practitioner, but people in the small business community, other taxpayers have come to us, and there has been that sort of experience relayed to us. And there are other experiences such as what are called speed-up situations where a taxpayer may receive a notice of audit and requests for documents, and suddenly they'll find in the mail yet another determination that they haven't even had a chance to respond to the first one on. And it's a way of intimidating the taxpayer into taking a position that's detrimental to them.
Mr. Shen, you're nodding your head there.
Yes, sir. We've seen this in a very similar fashion with foreign penalties on foreign reporting, and I mentioned it in my verbal and in my written response. We've seen it numerous times. That's why I make the comment that they need to follow the rules, or there needs to be a repercussion to the service. You follow it or you lose your opportunity. Somehow we have to hold them accountable to the process. That's why you have a Taxpayer Bill of Rights.
Spectronic?
Congressman, not sure of all the specifics around it, but in the revenue procedure that addresses cases, so if a taxpayer is filed a tax court petition, they generally can get their case heard by appeals before they actually end up in tax court if they have not already been to appeals. I don't remember the revenue procedure that covers it. So there are the provisions. However, you used a term that shows up in several of the revenue procedures, sound tax administration. I don't know what that means, but in regards to sound tax administration, they don't have to offer alternative dispute resolution, the fast track process that I talked about in my testimony. So I think there is sound tax administration is a way that they can choose to treat cases differently than what we would see as should be the normal treatment of a taxpayer and how their case would move through the system. What the answer is to that, I don't know, but I think the use of sound tax administration they're using as leeway to do many different things with a taxpayer's case.
Thank you. Ms. Wilson, you want to add anything to that in the final few seconds?
No, I just want to 100% agree with her that, you know, she's spot on the issue. That's why you see my head going back and forth violently, because I couldn't agree with her more on that issue.
Thank you. Mr. Chairman, I yield back.
Thank you, the gentleman from Oregon, Mr. Blumenauer. You're recognized.
Thank you, Mr. Chairman. I find the conversation fascinating, but in the backdrop of my experience when I visit our local IRS offices, and when I have meetings, which I do routinely with tax practitioners, tax attorneys, accountants, part of this strikes me that it would be easier to resolve some of this if the IRS was equipped to operate in a modern economy, if it didn't have a computer system that is so far out of date that they have to delve into the archives, find somebody encased in amber that can figure out Fortran programming. When I have meetings with people who work at the IRS and have them break into tears because they don't have any time to talk to people on the phone to be able to maybe help guide a little bit. There are people who don't fully understand the rules and regulations and the opportunities within the agency and the training budget. I hear from both people in the agency and from the practitioners who, interestingly, are not hostile to the IRS. They're frustrated. They're frustrated that they tell clients, you've got a good point. We can work together. We can resolve it and get your $3,700 back, but it'll cost you more to work with me to get it. And I just wonder what you think is attributed to the fact that we have slashed the budget, slashed the workforce. Congress, each year that I've been here, makes the tax code more complicated. And in some cases, it's a rush to be able to actually get the stuff out in time, and sometimes we miss the deadline. So at what point does Congress complicit in this by not taking the largest tax collecting system in the world, which relies heavily on voluntary compliance, and treats our employees and our taxpayers with respect and put the resources behind it to make it a... Any of you have any thoughts on that, Mr. Shen?
Yes. In Sarasota, at our office there in Sarasota, Florida, the number of people in there, the whole area that was set for walk-ins is gone. The number of agents has been reduced. I'll be the first one to stand up and say it's going to take more resources. If we're going to stand here and say we're going to provide more appellate officers, that takes dollars. If we need more access through the internet and to broaden our e-services, which obviously we're all nodding our head, we need to use technology to give access. And then those phone calls, extending the hours, all that takes money. And that's why we're here today.
But would that be helpful for some of these things if there were extended hours, if there were more people, if there was more training, a modern computer system?
So I would say additional funding would be useful. I mean, IRS can do some things administratively, but you mentioned training. I mean, I was commissioner of the Small Business Unit in 2008. And for me to have adequate training for my revenue agents who do the exams and the collection officers who did, the revenue officers who did collection, it was a really high-focused training for one of those groups each year, but I couldn't afford to have a real highly focused training for each of those groups, even back in 2008. So you can imagine, well, how this plays out in terms of taxpayers and practitioners. I mean, we feel like we're having to try to educate the revenue agent on the issues because they can't get the training they need within the service. And they're working issues on exams that they've never seen before. And so then they tend to go to somebody for advice. But you know how it is, you talk to 3 different people, how much gets translated as it goes down the line and is really actually comes to form a final conclusion.
I'd also make a quick plea for funding in another area, the Volunteer Income Tax Assistance Program and the Low-Income Tax Clinics. Right now, I think eligibility for the LITC program is 250% of poverty level. That's about $60,000 for a household of 4. That's not going to capture all that many small business clients, for example, who might desperately need assistance and could get it through a nonprofit organization like that.
Great. Thank you for your patience, Mr. Chairman. I hope at some point, when passions cool, to look at how we treat our accounts receivable and being able to think through the resource, the training, the computer, that I hope shouldn't be politicized, but I think the evidence is that will pay for itself many times over and relieve blood pressure medication.
Yep.
Thank you.
I hear what you're saying. They said the computers, some of them are back from the 70s and 80s and 60s. So I can't imagine that, but that's part of the testimony we've had. Gentlelady from Indiana, Ms. Lorsky.
Thanks, Mr. Chairman. And thanks to the witnesses again for being here today and lending your expertise to us. I think this has just been a fascinating conversation, and it has been a conversation, listening to your expertise and the questions that we have, and so much unanimous response that we all have. We're all kind of talking about, you know, all these same issues. One of the rights enshrined in the taxpayer Bill of Rights is the right to pay no more than the correct amount of tax. Mr. Sepp, I was struck that less than 5% of small business taxpayers appeal their audit determinations, and that a big reason for this is taxpayers believe it's cheaper to just give up and pay the IRS rather than appeal. To me, it's incredibly disheartening. If a taxpayer thinks they're paying more in taxes than they should, my advice is absolutely fight it. The tools are there to fight it. Instead, their perception seems to be that appealing it isn't worth the time or the money. We need to change that perception as well as the actual time and money associated with appealing. But I just wanted to address this to Mr. Sepp and Ms. Petronchik. You both discussed dispute resolution and options that would be less formal, lower cost for taxpayers. You also noted that the IRS has failed to expand its use of these fast-track dispute resolutions. Ms. Petronchik, can you explain how these fast-track procedures work and how they assist taxpayers in resolving cases quickly? And then I'm just going to tell you, my follow-up question to both of you, Mr. Sepp, as well, is there a way that we in Congress can do something about that, or is it purely just IRS authority? So I'd just like to hear about the options, and then, what can we do?
So in fast-track settlement, it's an option where, I'm being examined by the IRS, and we know that I have a dispute over, let's just make it simple, travel expenses. So they've said what their position is, I've said what my position is. So the taxpayer and IRS can agree that a fast-track settlement, having the use of an appeals mediator while it's an exam, would be beneficial to all parties to come to resolution on the issue. So getting to your earlier comments, it brings quicker resolution. The taxpayer is hoping to get this resolved at least cost, so they don't have to go on to formal appeals, much less go to tax court, which not only is cost, but many small and medium-sized taxpayers don't want their laundry aired out in public court.
Right.
So even though they may think they're right, they're not going to choose that as the venue to go to because they don't want their neighbors talking about their issues with IRS. And so fast track, We used to see a lot of them. We don't see as many anymore. But the procedures I talked about that small businesses using for their exams when they wait to the end of the process to have a discussion doesn't lend itself to having that alternative dispute resolution.
And what can we do about it, Mr. Sepp?
Based on my limited study of other countries' practices and what the taxpayer advocate has said, there seem to be several problems. One, we have to restore the independence of the ADR process. In almost every case, from Australia to UK, Portugal, all around the world where ADR is much more common and hundreds of thousands of cases will get resolved this way, they have to keep the mediator or arbitrator function well insulated away from the tax authority. We may not be able to use private accredited mediators here, much in the way that that appears in the Small Business Taxpayer Bill of Rights that was introduced in the last Congress, but we could have a situation where there is an office of mediation with specially trained people rather than plucking people from appeals who have some training in mediation and arbitration. You could even house that bureau somewhere in the Treasury so that it has further independence. The other important thing, I think, is to instruct the IRS where mediation and arbitration can be used. The agency will often exclude so-called campus collection cases and other types of matters for ADR from the start. And we have to resolve those kinds of issues as well.
I appreciate it. Mr. Shin, did you want to add anything quickly?
Yes, and in response, that's why I think, especially in small business, that it needs to be a requirement of the steps so that way people aren't afraid of appeals. It's part of the process. The fast track is there and it's part of the sign-off. I
appreciate it. Thanks, Mr. Chairman. I yield back.
I want to thank everybody for the opportunity, but let me run through, and this will be a question to all of us. We're trying to simplify the dispute resolution, trying to improve on the process. And I want all of you to take a minute on that. But before I do, I want to say a couple of things. I do agree with big corporations. Doesn't mean that there's not work to be done in dispute resolution, but I've been in that world. And you got CFOs, you got plenty of cash. If you got to go to court, you go to court. You don't want to, but they've got resources. What I'm concerned about personally is individuals. I read in the USA Today, 62% of Americans, I use this a lot, but it's stunning to me when I read it, don't have $1,000 in the bank. So if you get a letter from the IRS that you owe $2,000, where are you going to go resolve that? A CPA, accountant, it's going to be a couple, $3,000, $4,000. You're probably going to just say you're better off write a check or get on a payment plan, just agree with the IRS and move on. Small businesses, a dispute resolution, if you ever think about going to court, you could be talking over $100,000, $50,000. Did you say, Ms. Wilson, you're in a law firm? Okay, in a CPA firm. But you know, when you hand it off to the tax lawyer, you're talking big money, and usually you just cave and say, you know, let's go make the best deal and get down the road, even though I don't think I've got a, that's happened to me and others, I've heard of it, where they don't think they owe the money, but at the end of the day, the 10 or 20,000, the 5,000, the 30,000, it costs you more with accountants and lawyers to go try to resolve it. So the question I have for the individual taxpayer, the 62% that don't have $1,000 in the bank, how do we simplify this dispute resolution where people could have their day in court, but it doesn't take 6 months, a year, because as that meter's running, there's no way that you can afford to go to court or, you know, arbitration or work with someone to try to resolve that. And Mr. Shin, I'll give you the first opportunity from that standpoint. And I know you've dealt with that, but that's just my sentiment. And that's what I've heard over the years.
That's why I said we have to have the opportunity to have access through phone calls and walk-ins. And also when the IRS, when the taxpayer doesn't follow the deadlines, there are repercussions. When the IRS doesn't follow their protocol, there needs to be repercussions, because to the taxpayer, it's hard and fast. So I can give you one quick analogy that really struck me, is I helped an employee, 90-year-old, person of color who could not write. He was a night watchman at a packing house, worked several years there. Prior to that, he worked at another packing house where he treated him as an independent contractor, and he got billed. And he didn't know what to do and went all the way to collections, and they garnished his wages. He ended up with pancreatic cancer, and the employer asked me to step in. I tried to get the collection officer to settle, and the employer was going to settle. They wouldn't take a dime less, and he passed away 2.5 weeks later. I called that collection officer, I sent him a copy of a death certificate, and I said, that isn't in the taxpayer's best interest. And that's what we're dealing with, and it's so sad.
Yeah. Ms. Wilson?
You know, I now work at an accounting firm, but I was a local taxpayer advocate and worked with Nina Olson. So, you know, this is near and dear to my heart, as exactly what you're talking about, Chairman Buchanan, in the sense that...
Let me just say with you and all, we're looking to do IRS reform, and this is one of the biggest areas. I think we've got to find a way that people can, you know, get these disputes settled. So that's what we're looking for, but go ahead.
Yeah, and I think we need to simplify the process. I think it's intimidating, and I think because it's intimidating, taxpayers feel that the only way they're going to resolve it and win is if they engage help. And as your point, most taxpayers don't even have $1,000 in their account. So I think, you know, we need to find a way to simplify the process. We need to find a way to make it less intimidating for the taxpayers. And we need to focus on that Bill of Rights that says you shouldn't have to pay more tax than you actually owe.
Mr. Stepp?
We've got to find a way to institutionalize alternative dispute resolution mechanisms. We have got to learn from the experiences in other countries where millions of individuals have utilized the process, making it less formal, but more actionable, with fewer delays, applying to a larger number of cases, with a more independent arbiter involved. If we do those things, and H.R. 1828 from the last Congress is only a starting point for this, if we do that, I think we'll dramatically increase the access to justice that taxpayers need. Add to that things like the low-income taxpayer clinics, add to that more resources for the Taxpayer Advocate's Office, and you have the beginning of a core of principles that will get to this point of giving taxpayers the justice that they need, and they still need it.
You get the last word.
Okay, Chairman. So fast-track settlement, I agree, should be available for all taxpayers. Just to give a little history, Large Business and International developed this process 2002, 2003. It didn't become final and actually institutionalized for small business and self-employed taxpayers until 2015. So when I've commented on a couple of processes I think could make things more transparent and easy for taxpayers, there are some things that they have there. Now, fast track isn't the answer to everything because you may have reluctant IRS folks to use it. Pete mentioned, you know, I, in my written testimony, mentioned outside mediator or taxpayer. To them, hiring an outside mediator for $1,000, $1,500 is cheaper than taking this on to appeals or tax court. I hadn't thought about the concept of a mediator group, you know, somewhere in Treasury or somewhere that serves as an independent mediator.
The problem is if you owe $2,500 or $2,000, you can't pay $1,500 because you just say,
right.
You know, I'm going to go ahead and just write the check or figure out a way to write it. Go ahead.
But again, you know, IRS hasn't shown that they're extremely interested in this alternative dispute resolution. I would caution against saying, well, we mandate you to use alternative dispute resolution, because if they don't come to the table willing to settle and fast track, the taxpayer and IRS have to agree, or they just walk away and the taxpayer still has their appeal rights. So somehow, I mean, maybe looking at some of the other systems, come up with, well, what's the happy median here and how this could be changed. It's there, taxpayers would love to use it. Individual taxpayers need to be able to use it, which now it's available really to businesses, small and large. But it needs to be expanded and made available and at least cost and be successful once it's used.
Well, I would appreciate all of you get your thoughts and your ideas to our committee. We want to work together, the ranking member and myself, on a bipartisan basis because this is an important issue. And I've been in that world where, you know, larger organizations have the resources. I'm concerned about the person that gets $1,000, $1,500, $2,000 small business or individual tax bill. How do we resolve that without putting them into bankruptcy or putting them in a bad situation? And I agree with you. A lot of times you get that notice through the IRS. I've got more than my fair share, but a lot of us have. You know, it's frightening to a lot of people. And this is an area we need to work on and get your thoughts and your ideas. So in closing, I would like to thank our witnesses for appearing before us today. Please be advised that members have 2 weeks to submit written questions to be answered later in writing. Those questions and your answers will be made part of the formal hearing record. With that, the subcommittee stands adjourned.
Thank you, Mr. Chairman. Sir. Thank you.
This is a good area here we can work on. Yes. You know, 62% of Americans don't have $1,000 in the bank. That's USA Days, not mine.
Yeah.
I'm worried about them.
Yes.